Okay. Good afternoon. It's Tuesday, August 25th, and we are here for the school board briefing. On the agenda, we have 3 items on executive services. 2 have been pulled prior to the meeting. In operations, we have 4 items, followed by public comments, and then followed by the board comments, attorney comments, and Dr. Atkins' comments. If we could proceed, and if the speakers would, when they come up, would they please introduce themselves so everybody knows who they are? We would then start with COVID-19 notification and communication procedures.
All right, good afternoon, everybody. I'm Lauren Stillwell. I'm the Chief of Staff, and I'm joined by Beth Witt, who is our Health Services Coordinator. One of the last large pieces that we needed really to settle in before school started was how we notify and communicate surrounding COVID-19, and many folks have been integral in the creation of this, Beth being one of them. Bridget Adcock, Jason Stanford, Irma Lancaster and her team in communications, and of course our healthcare partners. So we give big thanks to all of them. And again, Beth is with me today to provide moral support and to make sure I don't forget anything, and also to answer any additional questions that you might have. So as I do the presentation, I'm going to be going through it, and I apologize if I'm not looking at you all the time because there's so much information. I made notes for myself to make sure I didn't forget anything.
You're great.
So really, there are going to be 2 ways that we're going to be notified about someone with symptoms and exposure or a positive case, and that's going to be outside notification from a family member, a guardian, maybe the FLDOH, or the student, his or herself, or we're going to be referring students and staff to our clinics or our isolation rooms if they're presenting symptoms throughout the day when they're on our campuses. So we created an internal flowchart, which looks really complicated, but we're going to break it down this afternoon so everybody understands kind of how it works, so that district leadership and school leadership understand how the process flows, and then also what they will be responsible for. And we have a flow chart as well for the district office. Many of the procedures and everything are the same, so I'm really going to just focus on the school one today. So zooming in so that you can see it a little better on your screen, we're going to focus on the first 2 lines to begin, and this applies to employees and students in our school building. The employee section on the district flow chart is very similar to this one, and we want to know 3 primary things which are in that first orange box. We want to know if someone's tested positive, we want to know if someone has symptoms, and we want to know if someone is exposed. And if the answer to these 3 questions is no, then that person can return to school or work. It's kind of like Monopoly. They can immediately pass go and collect $200 and go to class. But if they answer yes, which is the red box, they cannot enter the premises, or they need to be taken to the isolation room if they're already on campus. At that point, the COVID-19 notification form must be filled out, and that's a huge part of this chain, so I'm going to come back to it. So for now, we're going to just continue through the flow chart. We're going to assume the COVID-19 form has been filled out. We'll walk through the rest of the flow, and then we'll come back. So if the employee can't enter the premises, then it needs to be determined whether the person can continue working remotely. And if they can and they have manager approval, then he or she will do that. If they cannot, then they'll follow the sick reporting procedures, which is that yellow box, and they'll refer to the district website and also be able to call HR for information and forms regarding the FFCRA, which is the Families First Coronavirus Response Act leave. The employee may not return to work unless they meet the criteria in the last box on the page with the green heading. For those with a presumptive diagnosis with a subsequent non-COVID diagnosis, the employee can return to work with a waiver from a healthcare provider saying symptoms are not COVID related. If they cannot get that waiver, then we consider them having the presumptive diagnosis. And if this is the case or they test positive, they must stay home for 10 days and be symptom-free for 24 hours without symptom-reducing medication. Finally, if the employee has been exposed to a positive case, he or she may not come back until after quarantining for 14 days. And then you'll see in the flow chart for students that the same criteria apply. So obviously, a lot more has to happen before we get to that final step, and that is where the COVID-19 notification form comes in, which is where the red arrow is on your screen. We are creating a digital notification form that will be posted on the district and school websites. It'll be publicly available. The form and link are being finalized now and will be shared with you, staff, and all of our families. It's a critical step in gathering the information that the Florida Department of Health will need in order to assess what needs to be done. So there are 2 tracks, one for students and one for staff. It asks for all pertinent information like the name, date of birth, place of work, the date the person was last in our building, where the person was, when they were there, who saw them, all of that good stuff. When the form is submitted by the employee or the student, if you follow the blue line down, going back to the notification flow chart, so you're in the blue box, and if you follow that blue line down, when the employee or the student submits that, it will get to the principal secretary, or at the district sites, it'll be a leader in that department division. So we will receive the form that has been filled out, and then at that point, those who are designated will open a form, evaluate the information, and then they're gonna gather new information in order to enter into the form. And that new information that we're asking folks at the district to gather is the where, meaning where the student staff member has been. And in this situation for our staff, we're looking for like the fish numbers of the classrooms, if we can get it for that. Cafeteria, maybe bathrooms that the students have used, anything along those lines. We also want to know who the staff member or student has been in contact with. So in this case, seating charts are really important, not only in the classroom, but on the buses. So transportation will have a part in this where they will be able to upload the seating chart on the bus for when we need that information. And then finally, how to get in touch with people that student or staff member has been in contact with. So email, phone numbers, all of those kinds of things. So our school leaders or our district leaders will enter the information into that COVID notification form itself. And it's imperative that teachers keep the seating chart for every classroom and that we keep it on the buses. And I'm gonna kind of show you why now, because we need to know how far they are apart in those classrooms and on the bus. So these next few slides were created by the Department of Health in response to board member requests at a meeting a couple of weeks ago. So this shows the importance of social distancing in our classroom. If the desks were spaced 3 feet apart, we potentially would have 8 confirmed exposures, and the ill student would be the 9th, because anybody that was in that red circle would be considered exposed if they were 3 feet apart. If the desks were 4 feet apart, then we would have 4 confirmed exposures, and we would have 4 potential exposures. And then if the desks were 6 feet apart, you can see that we would only have 4 potential exposures. So this is super important. We have shared this with all of our school leadership so that they understand and they have seen these graphs as well, so that we can do the maximum social distancing in our classroom, because obviously our goal is to keep kids in school. So going back to the flow chart, once the administrators have the where, who, and how, or at the orange arrow, they're going to enter that information and they can upload those seating charts and everything like that right into the notification form themselves. And then again, if you follow the blue line, once they submit that, the form will go to Health Services Coordinator Beth Whip. And so Beth will evaluate it, and then if you move to the right to the orange hexagon, she will communicate with the school administrators if there's anything in there that she needs any follow-up or maybe more clarification on. And then if there is, she will get that information, she'll put it into the form, and then she'll determine whether or not the incident is a valid incident. And at that point, if it's a valid incident, Beth will notify the Florida Health Department, and I will notify the Florida Department of Education. We're supposed to get a FLDOE buddy assigned to us, and so I should know who that is this week so that we'll have direct communication with the Florida DOE when we're getting information in. Mainly about causative cases is what they're looking for. So when Beth talks to the DOE, there's some awesome things that are going on over there. The DOH. The DOH has actually assigned a representative to us for each of our zones. So we have designated to people to call per zone when we are notified of positive cases. It's the DOH's responsibility to assess exposure and notify close contacts and positive cases. This will occur whenever possible in the same business day that FDOH was notified, which is huge for us, because if we send them something in the morning, by the end of the day, those folks who are impacted are going to know about it through a phone call or an email or any information from the DOH directly. And then the DOH will also provide a letter excluding the staff member and student from the school or work site, and they'll provide that as appropriate. And then Beth will stay in touch with them throughout the process. Now, meanwhile, as the FLDOH works on determining the exposure, quarantine, all of that kind of stuff, we're continuing our process here at the district level. So we pick back up at the orange arrow with the district's COVID-19 notification task force. And most likely, the answer to the question of whether the incident needs task force attention is going to pretty much always be yes. So the task force is a diverse group of people from each district division who will be working with Beth. One group will be tasked with notifying those in their respective areas, meaning that once the task force is notified, the person in operations will be responsible for notifying maintenance so that when cleaning protocols and stuff need to be followed, that triggers that. HR might need help figuring out staffing, so if the person from HR knows, then they can go over and they can start working on that. IT would know in case we needed any kind of help with some kind of Chromebook distribution or anything along those lines. And then the other group that's part of this notification task force will be responsive to our school communities. We are setting up a hotline number and an email address, and that group will be tasked with responding to questions and providing information. We're outfitting the conference room at the end of the bus mural in the lobby for this group. We have phone lines in there and computers in there where they're going to be stationed. And so that will kind of be the district incident command or district operations center for us there. The task force will also be taking the lead on communication with families and the school community based on severity of the case. Right now, what we've discussed is that task force for the first couple weeks, the hotline will be operational from 7 a.m. to 7 p.m. for the first 10 days of school, like we have other secretaries and everybody available for parents the first day. And then the email will be answered by a team of chiefs after hours and on weekends. So we'll divide that up. So the email will be pretty much continuously being answered, and the hotline will be open from 7 a.m. to 7 p.m. for people to call in. So that's where we are with that at this point. So one of the biggest things that we have faced this summer, in all honesty, is addressing what to do if there's a positive case and creating a matrix for our schools so that we know how to handle a positive case in the school, and then hopefully it won't happen, but if it expands to more than one. So we've been working closely with a group of pediatricians and the Department of Health to create the matrix, and so I want to walk you through the scenarios that we have now. So on these charts, I'm going to focus mostly on the last two columns because we kind of just discussed the first ones about when folks will be allowed back in these certain circumstances. So I want to start with a student or a staff member who is exposed to a positive case. So in that situation, the student would not be allowed into the school, or if notification happened during school hours, the student would be sent home. The classroom itself would remain open, and we would do the presumptive positive cleaning procedures. We would implement those. Now, all of the cleaning procedures were shared with you in the manual that I emailed last week. We can email that again, and they're also on the district website, so everybody can see exactly what those entail. So the presumptive positive cleaning procedures would be implemented in the case of an exposure. Notification of the exposure would come from the Department of Health through contact tracing, and then the district will provide communication directly to the families who have been notified of exposure regarding how the student returns to school and how they access their classes while they're out. So that's one-to-one communication between the district and the family itself. So next we move to students or staff that have symptoms. The most important message that we can share today is this: anyone who has symptoms, please stay home. We will figure out a way for your children to transition to distance learning, to use Google Classroom, to make up their assignments, all of that good stuff. But please, if you have any kind of symptoms, we're asking that parents keep their kids at home and that employees stay home. However, if a student or staff member presents with symptoms at school, we'll recommend to the parent or guardian that the student will be tested. The classroom will remain open, and we will trigger symptom-triggered cleaning protocols that will be implemented. All of the cleaning processes, again, are explained in the manual that you were sent last week. The student will be placed with staff in the isolation room, and there will be a direct communication with parents and guardians on next steps, including stay-at-home guidelines, instructional continuity guidelines, and the return to school protocol. So again, that will be one-to-one communication between the district and the family. Now, if we receive word from a student or staff member that they tested negative after the symptoms, then there's really no other action needed. We continue to follow our routine maintenance schedule and the COVID cleaning protocols. However, if we get determination or notification that it's a confirmed case, then that's where the following occurs. We will consider classroom closure at the elementary school level. The matrix that we have developed has us closing an elementary classroom with 1 to 2 positive cases. The reason that we would do that at that level is because the kids are younger and we cannot guarantee that they've been able to follow all the protocols and social distance for the time needed. So again, at the elementary school level with 1 to 2 cases, we're most likely going to close a classroom and transition that entire class to distance learning for those 2 weeks. If there is a positive case at the middle or the high school level, the FLDOH will identify students in close contact with that case and will direct those students to quarantine for 14 days. At this level, the classrooms would stay open because we have a better chance of identifying just those students who need to quarantine. In both of those cases, the schools will remain open and we will implement our confirmed positive response mitigation protocol. Per the matrix, which was developed with local healthcare providers, if our positivity rate at a school reaches 5%, we will most likely close that school. If the positivity rate at the district reaches 25%, we will close the district and transition to distance learning. We might also look at only closing zones depending on where that community spread is. So it's possible that we may shut down, the west zone if we get to 25%, but we're not seeing that level with the other schools in the other zones. Obviously, all of that will be done in conjunction with our partners at the Department of Health and our healthcare providers advising us. Relating to notification and communication of positive cases or exposures, that's the role of the Department of Health. They will be contacting the employees and families of students directly with information relating to what they need to do regarding their health. The district task force will also be notifying families regarding the steps for instructional continuity and return to school protocols. However, in the case that we have a positive at a school, the district will send a communication to the school community letting them know that there is a known case. Okay, so we will be notifying all of the folks that are in that school that there's a known case. One of the things that we did talk about was also posting information about positive cases to the district website. We're still working through what that would look like with the Department of Health and our attorneys. We want to make sure that however we present that data to the public, we ensure accuracy and also are able to help protect the health privacy of our students and staff. So that is still undergoing discussion. So just to wrap it up, for the school level, the FLDOH and district administration, the school will stay on top of the COVID-19 notification forms. They'll identify the where, who, and how, and they'll communicate with their designated district notification task force member. The FLDOH will determine exposure and positive cases. They will notify families and staff, and they will advise on quarantine closures, isolation, and positive cases when we might need to close. And then district administration and our task force will be responsible for communicating and notifying FLDOH and FLDOE, determining any closures with guidance from health partners, notifying the district departments so that action can be taken in the schools, and then sending communication to families and staff members in the school community when necessary. As mentioned, the district notification task force will work out of the command center, and again, for the first 2 weeks, they'll be open. The phone line will be open from 7 a.m. to 7 p.m., and we'll have a staff together, a team of folks that are going to be answering those emails, and we'll be able to release that email and hopefully the phone number this week, as well as the notification form. And then honestly, the hardest thing in all of this is going to be the timing. We know that parents and staff are going to want immediate information, like 5 minutes after we may get notified ourselves. So we really are asking for patience in the process. We have to work through the process. We want to interact with the Department of Health. We want to do it, obviously, as quickly as we can, but we also want to do it right because we want to be able to make the decisions to keep students and staff safe. And then the last slide on here, we are creating a public document, and we already have information on our website that concerns our matrix and the communication and notification process. But this is an example. It's being updated now, and we should have it by the end of the day, if not tomorrow. So this will be a document that will go out to all of our families and our community. The goal is to set expectations in a positive tone up front so families understand how we're making our decisions and the type of information and communication that they can expect as we move through this. And that's all I had. Forget anything?
Do we have any questions, please? Chris? Ms. Patrica, please.
Thank you. Ms. Stillwell, I'm going to have to watch that tape 3 times in order to digest everything you just said and be able to answer questions as they come to me.
Give me my notes.
It was very, very comprehensive. not at all surprised that you brought something forward that is very comprehensive, because that's what we asked for, and that's what you gave us. Thank you, thank you. I do have several questions, and I'm going to use a personal example. My youngest son suffers, and when I say suffers, I mean he literally suffers from allergies. Every day, all day, he takes his medication, he never forgets, and he still sneezes and still has a runny nose and still coughs. I do have a note from his doctor saying that he has allergies. Is he covered if I have that on file at the school, or is he going to be sent home every day?
No, he's covered, but I'll let Beth.
I believe it's live, yes. So, yes, we are asking for documentation, and that's perfect that you've already provided that and you have it on file. That way we understand the student's underlying medical conditions, and we can make a determination, okay, these symptoms fit his underlying condition, therefore let's see how we can help him with this condition if he has medication at school that we could provide for him, if he needs to go home because he needs to take that medication, but let's keep him in school because that's where he belongs.
Okay, so he actually wanted me to get him a mask that says, calm down, it's just allergies. But I don't think that would fit the dress code at his school, so I didn't let him get that. All right, that's great. Good to know, thank you. Because I had heard something yesterday during the live session that allergies would result in a send home, but I'm glad to hear what you're saying now.
Yes.
Can we go back to slide 12 for a second, please?
Now you're going to test me. I got to figure out which is slide 12. The 6 feet apart one?
Yes.
That one?
So what about the teacher? What if the teacher is the one who is positive? In this scenario, who is exposed?
So that would be the role of the DOH to determine whether or not the teacher would be exposed. And if that was the case, then the teacher would be quarantined for 14 days.
No, the teacher is the one that's positive.
Oh, well, at that point, then what we would do is that we would notify the DOH and we would upload the seating charts, and then we would determine based on FLDOH's guidelines what we would do. But again, in an elementary school classroom, most likely we would close that classroom because it's a single positive case.
Okay.
Everybody then would be able to hopefully transition over to distance learning with that teacher if he or she is well enough to teach.
Okay, and then the DOH is the one that would contact those who are exposed and potentially exposed. That's
Correct.
not on us. We notify them, and they do the contacts based on these seating charts. Okay, 1 or 2 cases will likely close an elementary classroom. Who decides that? Is it the principal? Is it Dr. Adkins? Is it you, Ms. Stillwell? Who decides that?
Well, I hate to put Dr. Adkins on the hot seat, but it's Dr. Adkins. It's according to the reopening plan and the guidance presented by the state. Ultimately, the control sits with the superintendent to do that.
Okay.
But obviously, we're not going to do that without guidance from our health partners and from Beth and from, a number of other people. But ultimately, it would be the superintendent, not the school administration.
Understood. Okay, and then, again, you gave me a lot of information, so some of it I'm just repeating to confirm.
Yep.
5% positivity in a school will likely result in the school closing down.
Correct.
Okay, and then, as you were talking, I realized that you're a parent, and the people who put these plans together are parents. So you were talking about wanting immediate notification, and you're putting plans together based on what you want for your own kids, and understanding that you want to know immediately if there's a positive case in your kid's classroom, but also understanding that that's not always going to be possible. And it's not just that our staff that's putting this together are parents. It's also that the teachers and the staff in those schools are their colleagues. And so, this isn't people who are removed from those who are in schools who are making these decisions. These are people who have a personal stake in the outcome. And so I just really want that to be clear as the public digests this, that we all have a stake in this, and we all know people in the schools, and we love them, and we care about them, and we want them to be safe. And I'm really impressed with what you've given us here today. And like I said, I'll watch it 3 times. Those are my comments for now. Thank
I'll
you.
send you my notes.
Perfect, thank you. Ms. Giovanelli, I think you had your hand up?
No.
You did not, I'm sorry. I know Ms. Vaughn did. Sorry, Ms. Gibbs, I'll get you.
Yes, and I agree. We've put together an incredible plan. However, we've got to think about the entire community and what's going on out there in terms of testing and how soon the results get back. Do either of you know what the average time is
For test results?
from test results
So
right
I
now?
don't, I know that it's quicker now than it has been, but if the volume of tests go up, then it's going to then it'll make it longer. And so that's kind of obvious, but that was the last conversation that I had with the DOH, is that right now I know that there are some docs that we've talked to that have been getting in a 24, 48-hour turnaround time, but they expect that it'll take a little bit longer if there's an increase in testing. We also know that there are a couple of our pediatric groups, and this was said yesterday in the Facebook, which is awesome, is that some of them are getting some of the rapid testing so that they would have that for their families, those groups. And so I think that the more that kind of comes out and becomes more prevalent, the quicker we'll be able to get that back.
But that's at a cost.
That is at a cost for those folks, yes.
That's at a cost.
That is true.
Which is, I see this as a problem. Have we done anything to try to establish some kind of a partnership with, let's say, with the county? I know I was reading, I think it's the city of Jacksonville, and I forget, maybe some of you Florida people know
Lake
what
County?
county that is.
Lake County?
Lake County.
Lake County?
Yes.
Duval.
Jacksonville.
Yeah, Jacksonville's Duval County.
Duval,
Yeah.
okay. All right, so I believe that, I think it was I didn't bring the notes, I should have, but I think it was a $1.5 million agreement that they made, and it's for the government workers in the city as well as school and all of that. Have we explored anything like that?
Yes. I don't know that it's to the extent of what Duval County has done, but we have been working with the DOH, and then we also are working with Lee Health to see whether or not there's anything that we can do. One of the things from the DOH is that their response rate is 24 to 48 hours for test results. So we have talked to them, and we would be able to do an agreement with them if we chose that they would provide the kits for free and the shipping for free. And then we've also reached out to Lee Health to see about the locations where they do testing. And so I have a call hopefully this afternoon with a woman over there in order to see what other information we might be able to get. And that would be for staff and students.
Okay, but obviously none of the other government entities have expressed interest in.
Well, I did speak with the county today. I was actually
Okay.
on the phone with the county manager today, who just was in contact. Remember, he's also, they've offered up masks, so they have a pretty massive shipment of masks that we're going to be, I think, taking ownership of very soon. And then he also has CARES dollars that are available that he reminded me, we need to have those spent. So if you are doing anything in cooperation with Lee Health, as it relates to rapid testing, where we stand by you to help with the cost of it, so.
Okay, I'm glad to hear that. I remember you'd mentioned before what they're going to do to help out, but, all of the experts say that the rapid testing is key, and even though we have a wonderful plan here, there's still, with so many students going back and teachers and all of that, everyone is expecting at least some kind of a spike. And as you said, with the spike, there's going to be more testing, it's going to take longer, and all the experts agree that the faster the turnaround, the easier it is to get it under control. So what I'm saying is, if we can explore any additional ways that we can get faster turnaround for our staff and our students at no cost, because I know, most of the staff has insurance, but we have so many kids that the parents can't afford that. So I'm just hoping that there'll be some people stepping up, in Department of Health or the other government entities offering partnerships for the really fast turnarounds. So those are my comments.
Thank you.
Thank you, Ms. Vaughn. Ms. Gittens, please.
Okay, thank you, and thank you for all the hard work.
have a couple of questions. One, looking at the staff intensity of the things that staff has to do, and especially looking at the situation now where, a lot of even the extra, I guess you would call it, staff, coaches and all that are taking classes to alleviate some of the load on the classrooms. How are we going to, because when I looked at it, and my first kind of thought is somebody's going around with a clipboard trying to make sure that all of this is done and checked, and then get it to DOE and follow all of the steps. Do we have the staff available to follow up on all of that? And how have they been trained to do this?
So we had and Beth can help because her school nurses and clinic assistants are doing some of this too, but when we had our principal meeting, we walked through all of that with them. They've been, while the notification form isn't ready to go, they've been practicing this already and gathering that information and all that stuff for when they call us now. We're hoping that we can use Focus for the school or for the seating charts, so that literally those would just be built. So they could go in, they could retrieve it right from the program, and then we upload it. So we're trying to automate some of that as well as what we're working on with transportation. So I think we're going to have to. We haven't heard any concerns at this point. I think we're going to have to get into it, and then we're going to have to figure out how it's going, and then we're going to have to reallocate if that's what we end up needing to do based on what we're on the information that we're getting and what we're hearing from our schools.
Because it seems like, if you have a contact in a school and that knows, the nursing people and the, Department of Health and all of that, is kind of a more foolproof, if we can say that, situation, because they know exactly what to do as opposed to whoever's available. You know what I'm saying? In other words, if there is a contact at each school that is trained, that knows and follows through, and it seems like it would be more.
Well, that would be, whoever the administrator would assign would be that contact at the school. And then the support would also be from the nurses and the clinic assistants.
Okay.
Yeah, and I was just going to add to that with the task force, we will be in communication with the administrators at the school. We also have our school nurses and our clinic assistants that will be very well versed in the process and be able to communicate and answer any questions at the school level for them. So we'll be in constant contact with them.
Okay, thank you for that. My next point has to do with the 3, 4, and 6. Most parents have heard, whether that was what was put out, what they hear when we say we are going to maintain CDC spacing is 6 feet, because that's what everybody hears is 6 feet. I would venture to say there's probably a lot of parents that don't know the 3 and 4. And it's not out there as much as the 6 feet is out there. I don't know how much time or how much effort has been put into letting parents know that.
Well, these were, so 6 feet is what we've been going with when we can socially distance in the classrooms. That's what we've been putting out there is the 6 feet. These were created for the board by the Department of Health as illustrations of what might happen if we can't get that 6 feet distance.
Well, and like I said, I hear from a lot of parents and a lot of teachers that are saying it's not going to be. I mean, they're saying in some situations it's not even the 3 because of the number of students in the class. And this type of visual for parents, I think, would help them to make a better decision. Because if I were a parent and I saw that if we have 6 feet, the chances of my child getting something, I feel a little bit better. But that one with the 3 feet is kind of scary if you're concerned about that. So the visual, and I know it's in retrospect, but this is the kind of thing that parents would have helped them to make their decision as to where they wanted their child to go. And what I hear a lot from parents is, well, we don't know, or we don't have all the information. Not that they don't want their child to go back.
Right.
but they just want to know. So that would be something I would suggest that we make sure we get that out there.
Okay.
And then do remember, I mean, one of the things that Dr. Spiro had talked about yesterday is all about this class balance. And so people may have looked at class lists and focus that had 30 in a classroom that would not reflect the actual number that would be in there that particular day. So again, this was created by the Department of Health for, illustrative purposes. It doesn't mean that's going to translate into necessarily what's going to happen in the classroom. I think that what we have done consistently is report to our community 6 feet where possible. That's been the consistent message, and that's still, we maintain, that is what we are striving for in every single classroom and in every single situation.
And I totally understand that, and I, see where you're coming from, but the two words that scare parents right now are the where possible. I know we're working hard on getting the classes, leveled out and getting the class rosters, and yes, teachers not, hanging their hat on what's on focus right now, and they understand that. But the concern is still there, that is my child in one of the classes that we didn't get down to 20.
Oh, I understand.
Okay.
Yes.
So I think to kind of help those fears, that where possible is a scary thing for parents. The other thing is the simplicity, and I always harp on that. This is an excellent plan. It is very thorough, and I thank you for working and making sure that this is done. But I'm going to give you a scenario of a socioeconomic group that the adults have to work or looking for jobs or whatever, and as opposed to a family that is a higher socioeconomic level. They've got their thermometers, they've got everything, they understand all of this. The other socioeconomic group of parents, their child needs to go to school so they can work, for example. And the child comes home and they say, I don't feel too good. They don't check the temperature. As Ms. Vaughn was talking about, how do they, sometimes don't even have a car to go, let's go get you tested, or sit in line at Hammond Stadium. They don't have that ability. And the thought of the child staying home is going to hurt them, because now they got to find somewhere to leave them. So it is really a situation. They give the child some tea, rub them down with Vicks and say you'll be okay, and send them to school the next morning. And not out of any negativity towards anyone else, but that's what they know and what they have to do. And my concern is, have we really looked at that group of parents? Because they just may, and I'm not saying they're dumb or stupid or anything like that. It's just the availability and the exposure to what they know and what they work with. I mean, you have a lot of parents, even from the islands, and their first line of defense if you have a fever is, lemongrass tea, or, ginger tea or something like that. And this is so much further than that. So the education of the people that understand this, and the education of someone that understands this, how are we bridging that gap?
Well, first of all, I do want to say, Ms. Gittens, that, the comments that you make are something that in Manatee County, there was a similar experience, and I think we're trying to strive for what they were doing up there in Manatee County, which is trying to push the communication out as best we can to all groups within our community, and the guidance relative to You know, if you feel sick, stay home, you know, that type of guidance. That is something that they made a real effort to do, and I think it's helped reduce their spread. They've had very few cases since they have opened up. They are currently opened. And so not only were we already implementing measures, but we've taken heed to that advice and kind of redoubled our efforts to push that out to the community, as you know, because that is a difficult population, as we've had many discussions about. It's a very difficult population sometimes to reach. So working with our schools to make that happen even better, I think, is something that's going to be critically important this week. So it is a focus this week. We took that advice under, I mean, that was good advice provided by Manatee County for the sole purpose of improving districts that hadn't opened yet, our plans. And so we've, you know, that is just something that we continue to reinforce. The other piece of it is that's why that we are working to train staff in buildings in terms of identification of symptoms, and we have procedures in place to isolate those students, as you heard, you know, Ms. Whiff speak to, because I do acknowledge that is going to happen, and you know, we are going to have to be ready to respond to that, and you know, that's why this training that's occurring in our buildings is so important.
And then when you think about the
Ms.
most
Gittens,
vulnerable kids is that list. Just one last thing
Yeah,
I
if I
want to
can get
say.
you to wrap it up.
Can we simplify to any of this information in even visual, like a cartoon or something that's virtual, that they can watch, and okay, this kid is sitting here and they sneeze and you do this and whatever, but simplification of it. And thank you very much. I'm done.
Thank you. I'm sorry, Ms. Morgan, did you have any questions,
No,
please?
thank you.
Ms. Giovanelli?
Thank you. Okay, I just want to say this is awesome because I think it's a really awesome plan and you've really thought everything through. So one of the questions that I was trying to read and see was that to return to school, they have to have a note. Who do they give the note to? Like, what's that process? Because I don't see it. Because I don't know that should it, because of HIPAA, do they take it to the school? Do they have to come through the district to get the release through the district?
Oh, I see. So if they came back and they had a negative test, or they just had the doctor's note, it would be
the note
normal
says
procedures,
they're-
right, Beth? Just like giving it to the clinic or the assistant at the school, just
So-
like you would if you were bringing a sick note.
Are you referring to the note to if they are diagnosed with something other than COVID and they want to come back sooner? Is that the note you're referring to?
Well, actually, it could go either way. I mean, that's the normal thing they do when
Right.
they've been sick.
So-
They just come back with a note from the doctor. That's normal.
Right.
But as well as COVID, I mean, does that have to go through the health department to make sure that everybody's reporting in containment? Like, that process is what I'm trying to figure out.
Sure. So any documentation would go to the school level, just like they normally do for any sick notes or any doctor's notes. It would come to the school level.
And then we could share it with the health department if that was necessary.
Okay.
Or in some cases, the health department might get the notification directly from the healthcare provider.
Okay.
I'm sorry, excuse me. Ms. Giovanelli, would you please put your mask on? We're requiring and asking
Okay.
everybody else
Well,
to
I
wear
can't-
them.
Then they can't
I know.
understand me.
Thank you.
Okay, so then, so the hotline is from 7 to 7, so that's awesome. I wanted to say how great that was too, because it's really important they know where to go to start the process, because it may not even be COVID.
Right.
I think that the testing piece is very key, and I know Dr. Atkins did reach out to Dr. Antonucci now, and I know that that's in a process, but I thought that it was a great idea regarding, collaborating with other government entities, so I think that's really important.
Yes.
I've been asked by several elementary schools and parents about the desk shields, and they're really concerned because we have them, and yet they're not being implemented at all in the school system. Is there any way we can look into that and what that cost would be and entail, at least for elementary? Because I don't know how long they can wear these for 8 hours during the day. And if they had the shields, then that would help them not, they could take a break and not, and I think it would just allow a little more learning ability to, and not be, if they have glasses, they're going to be fogged up half the time.
Right.
And reading.
And I don't know, Dr. Desamore, if there's anything else you'd like to share. I know that, we've certainly expanded the use of these as we've learned more, particularly if you talk about those situations where you have those desks that have to be divided, those types of situations. So, Amy, I don't know if you have anything additional you'd like to share. I know you've been looking at this issue.
Yes, I can. These that you see up here, that we have up here, are what we're calling counter shields. So these are what every location has in place for those areas where there is a reception, like in the front desk, or where you would receive lots of people or visitors. We have these at every location. But then also, in addition to that, there'll be desk shields for students that will be provided as well. We hadn't necessarily we hadn't planned on doing that on a one-to-one basis, like one for every student. But in the cases where you have tables where students sit, where you want to divide up the tables, or if they're sitting on, some of our desks are situated where there might be 2 or 3 of them that are kind of together, and you need to put the desk shield in between there. We have those that will be provided to all schools as well. We expect to get the shipment of those desk shields in by Thursday, and we'll be working hard over those next several days to make sure that every location gets their shipment of those before Monday.
That's awesome. I didn't know that, so that's awesome to know. One other piece that I was trying to see was regarding if a teacher were to be out and they needed a substitute, what's that process? Because we're getting limited in teachers, and the classrooms are large, and I'm hoping that they will not be when everything shakes out. But I'm concerned that what if we don't have a sub? I'm very concerned over that. So, like, what happens? Does that go virtual?
I don't see Dr. Pruitt here, but I don't know if Dr. Spiro, if you can add some. I do know that we have kind of an all-hands-on-deck approach with all instructional staff at the building, including administrators. I know as an AP and principal, we often had to go into classrooms just to make sure they were covered by certified staff. And I do know we're also working with our substitute pool. So
as far as the school, I can give the school point of view. I certainly cannot give you HR. Dr. Pruitt would have to answer that. But we are, any certified teacher in a building who does not have children in front of them, reading coaches, math coaches, science coaches, PCTs, any of those individuals will be all hands on deck, as Dr. Atkins said. They'll be covering classes. In addition, here at the district, we're going to be having a process that if we have certified teachers here at the district who can support schools as well if they're short, we are committed to making sure that folks here at the district are inside schools helping as well. So we are, it's kids first, it's classrooms first, and we're committed to making sure that that happens.
Yeah, we really anticipate, and we have the full expectation that in terms of staff down here in the district office, all of us really have to be, ready to go 24/7 to be deployed wherever we're needed. So that's just kind of the expectation. You just don't know. I think we've got a great plan, and I'm very encouraged by what I see happening in other school districts. But just in case, it's just better to be, conservative in your planning.
So the Department of Health will be the one notifying the families when they start contract tracing?
Correct.
Okay, that's good to know. And so I thought I wanted to make sure. I think most of my questions have been asked. I really thank you for all the work that's been put into this. I know it's probably changing quite a bit because things change, like the 10 days and versus the Fit 14, and so I understand that, and the mask thing, I get it. So I just really appreciate all the work that's being put in, and then the summer, that was something that we talked about, Dr. Atkins. So Home Connect, getting their lunches and breakfast. Can someone touch on that a little bit? I think that would be important as well.
So we do have, thankfully, we do have the ability to do that. We've got 2 opportunities throughout the week where students can pick up literally all their breakfast and lunch once a week at a middle school or high school. So that information is going out. So again, there's 2 options in terms of times. The location is the school, the middle school or high school nearest to your elementary school, I believe, so.
Yeah, actually, the list, we did receive that. So thank you for sending it out. And it actually tells you the time and the schools where they need to go to. So
I just
they have,
wanted to mention it, though, it's for
Oh.
the community to understand that.
yeah.
So, no, I know he explained that to me, but, so I just think it's great, because everything is we're just gonna do everything just 4 different ways, right? So I just appreciate the options, and thank you, and I want to thank everybody for the summer grab and goes too. I appreciate that, because I know that was something that needed to continue as well. So I thank all the staff that worked on that and having that in my classes.
Yeah, food and nutrition services was amazing. Thank you, Dr. Desmore.
Thank you.
Ms.
Thank
Vaughn,
you
did
for
you
that.
have one more question?
This is just very quick. One question since the grab and go was brought up. I've been following parent comments on the Lee School site, and where we posted the charts, the link to the charts and all of that. And actually, I was going to ask somebody specifically about this when I had a chance today, but to clarify it, there were 2 parents who insist that when they called their school, and these are both parents that have children at 3 different schools, that they were told that they had to go to different schools to get the grab and go. That's not what it says online, and as a matter of fact, I posted it and I said, no, and then somebody said, Ms. Vaughn, you're wrong, and there were 2 people that insisted. So can we clarify that here? They pick one. If they have 3 different schools that their children.
Okay, so their kids are at 3 different schools, and then the homeschool might be different for those 3 different schools, is what you're saying?
Right.
So we'll
but
look
they
into
don't-
that.
Because of that, they just pick the one. They don't have to go around to 2 different sites, do
Yeah.
they?
Amy, Dr. Desmore, could you help?
Because that's not what it said.
Susan
I
can.
went back and I read the instructions, and it looked like
timing
it
is
was clear
impeccable.
that they only had one, even if they had kids at 3 different.
Susan's going to answer it.
Hello, everybody. As with everything, things are changing a lot. We're rolling out something new, so we're gathering the information and getting it communicated. We will allow parents with students at multiple schools to go to one school to pick up their meals. We have a form that we will be publishing, and they will submit the form so that we can capture that information.
Well, and I saw all of that online, but they insisted that when they called their home schools, the schools gave them different information.
Okay.
So that's what I was concerned about, and I said, I'm going to check it out today.
Right. So there's a lot of new and evolving information with all of our new and evolving processes, so everybody hasn't received that information yet. So we'll make sure that we get that to all principals and secretaries for distribution at their school.
Okay, and may I suggest then that, this is great information that we're putting out on the Lee County Facebook page, and yet it's causing turmoil with some of the parents who are reporting different information. And I think maybe there needs to be a clarification on the Facebook page.
Sure, okay. We can do that, or comment on the comments to be able to provide that information.
As I said, I did comment, and I said no, and they said,
They
no,
insisted.
no, Betsy Vaughn, you're wrong. This is, and it was 2 different
Can
people.
we, thank you, Ms. Vaughn. Ms. Kenton, do you have a
Yes,
quick
I'll
question?
make
Because
it- I'll make it quick.
we're supposed to be 20 minutes on this, and we're almost into an hour, so
Well,
please.
2 other things were pulled, so I would think we'd have enough time,
But there's other people who have not spoke yet, so please.
Well,
Go ahead.
Okay.
Ask your question, please.
the question I have is about reporting. You mentioned Manatee, and I looked up Manatee, and one of the things that they are doing is saying, you know, at this location, there was a reported case or whatever, and I really think we need to, we've had, from my count, about 20 or so cases in the district, and I think it would be good for the public to be able to know that this school or that school, not the who, but the fact that there was a confirmed case or exposure or whatever, so that parents have information.
So that's what yes, we're talking with the DOH and the attorneys about how we might make that happen. But we have to be careful because in some of our schools, we have to be careful when there's a small population and then we're reporting numbers that we inadvertently could identify people. While we might not be giving the names, they might be able to track down who they are, and then we could be in trouble for violating HIPAA and privacy. So that's the stuff that we're trying to work through now to figure out how we would do that. So we're looking at like what FGCU is doing, what FSW is doing, and then working with the
Manatee
health
has theirs in
department.
there as well.
And yeah,
Okay, thank you.
yes.
Ms. Morgan, did you have anything to say?
No, I just would say that you guys
Okay.
have done an extraordinary job. I am incredibly impressed. Thank you.
No, and I have to agree too. I really appreciate all the information that you've put together. And thank you, Ms. Giovanelli. I was going to ask the same thing about the plexiglass, so thank you for bringing that up. And I guess, and again, Ms. Gittens, with going back to simplicity, as you just said, simple, stupid, people understand more. But again, thank you so much.
I did have a second round of questions, if I may, just super quickly. When the DOH was here, for us, it wasn't physical, it was Zoom. Didn't they say that they had rapid tests for less than 48 hours for kids under the age of 18? That
Yeah,
they were considering mobile testing?
correct, yes.
Okay, and then in my conversations with people at Lee Health, my understanding is, and Ms. Whip, maybe you can help me with the language. Is it a reagenting solution that's used in these tests? Is that what it's called? So it's my understanding that as testing increases, they hold on to that reagenting solution very closely because they need it for their own patients. So while a partnership with Lee Health would be fantastic, I think that at the height of testing, it would be most difficult for them to share that testing with us because they need it for their own patients. That's been my understanding in my conversations with them.
Sure, and it depends on their supply.
Exactly.
So we would have to take that into consideration, but we do want to start the talks and the process so that when it is more readily available, and we know that the rapid testing is becoming more available nationwide, that we would be able to partner with them. We would have some talks already in place and hopefully some plans of how we could activate that.
Fantastic.
Yep.
Great, that was it.
I'm
Thank you.
sorry, Ms. Fisher, I know you just came in and welcome. Did you have anything?
No, I have no comments right
Okay,
now.
thank you.
Thank you.
Okay, thank you so very much. Really
Everybody,
appreciate
thank
it.
you so much.
So next, we're going to move into operations. I think it's Ms. Ebal.
Yeah, today's date, yeah.
Do you want PowerPoint or?
Yeah, PowerPoint. I think she's gonna stand back there.
What's what?
That tall girl back there.
PDF.
I would assume she's part of this
Okay.
presentation.
Okay.
The socially distant.
I know, I don't, just don't recognize.
Good afternoon, Board. I'm excited to bring to you today a partnership that we have been working on since probably the beginning of this year, and working very diligently with our partners at Fort Myers Beach Elementary as well as Fort Myers Beach. Today, Chelsea O'Reilly is here, the Public Works Director, to discuss this as well as their consultant. And this is a partnership that will link together an improved Bay Oaks Park Recreation Campus, which already exists but will be greatly enhanced by the town's efforts along with Fort Myers Beach Elementary. And at that, I'm going to turn it over to Chelsea and Matt and let them take it away.
I'm sorry, Ms. Ela, who is the gentleman?
My name is Paul Benvey.
Thank you.
Oh,
Go ahead, I'm sorry.
Yes, my name is Chelsea O'Reilly. I'm the Public Works Director for the town of Fort Myers Beach. Today we present to you the Bay Oaks Recreational Campus. This is an effort that our town council and governing board have supported. We are actually pursuing a $10 million loan to be executed October 1st. $5.5 million of that loan will go to the redevelopment of this campus. So with that, I'll turn it over to Paul Benvey, who was contracted by the town for the design of this project. So, thank you.
Chelsea. Just want to say one quick thing. I'm a graduate of Lee County School District. I graduated in 2000 from Fort Myers High School. Yay. Y'all did me proud. Thank you. We can go to the next slide. Unless you want to just give me the controller. Yeah, wipe it down. I'll wipe it down after. Yeah, we're good. All right, so this is a rendition of the current campus as it's currently designed. We're going through a couple of different iterations. We're kind of in a master planning stage at the moment. The key points here that pertain to the school district is how we're going to interface with the Beach Elementary School. Some things that exist right now are the school can come into the fields and play on those fields. There's playgrounds. There's an existing gazebo. There's existing parking, and a lot of these amenities are being shared between the town-owned property as well as school district-owned property and even some Lee County proper property. We'll go to the next slide here. So this is a look from an aerial view from the north looking south. The school is up in the upper left-hand corner. And this is what the parcels look like right now. They'll be identified here. So the peach color parcels are owned by Lee County School District, and the bluer color is our town's the town-controlled lands. So as you can see right now, there's certain amenities that are being shared by both on different parcels. And if we zoom in here, you can kind of get a better idea. You can see that some of the parking lot is there in the blue. The gazebo is there in the blue. Again, these are town-owned lands. And then some of the amenities in the peach that are being used by the park are owned by Lee County School District. So as a part of this process, we looked at swapping out some of these lands. The lighter blue now would go from Lee County School District to the town, and the yellow areas there would be gifted back to the school district in exchange. And this is what it kind of will look like right now as far as what the amenities would look like. So the yellow area at the top would be secured parking. It'd be gated with an access only by school employees during school hours and ahead of time and after time as well. The purple area would be the secured amenities that would be constructed as a part of this project, and they would be primarily used by the school during school hours. There'd be controlled access there and gated off 100% from the public. The red area here is where you saw that multi-purpose field. That would be something that would be worked between town personnel and their schedule versus the school's schedule. So if there's a PE class that has to do with football or soccer or something like that, they could work out that schedule with the town, and they'd have access to those parks as well, those parts of the park as well. And there also would be a secondary gate around that red area to prevent anyone that hasn't checked in with the school from getting into that area during those times. So again, this is the plan as it exists right now. And for the most part, everything that's happening over here and adjacent to the school is pretty well solidified. Exactly how that multi-purpose field looks may get altered a little. The key points are, again, controlled access to the parking area with covered parking provided, a covered playground area, a new playground. The existing one, I guess, is not in the greatest shape, and it could be replaced as near the end of its design life. And then we also have the existing gazebo that would be maintained on in the school's primary area. There's an outdoor classroom and some student gardens, and a lot of these little areas there still have to be defined and agreed to with the school. So here are those colored blocks again to kind of show what it was looking like on the aerial versus what it looks like here in the current design. Again, you got the secured parking, the purple area are the secured amenities that primarily remain with the school, and the red are the areas that the town is willing to share as needed and as scheduled. So part of the interlocal agreement stipulations included that covered playground, shaded courts. So right now, if you go out there, it's an asphalt court. It's hot. If I was a kid, I wouldn't love playing on it. So we're going to look at covering those. Again, covering and securing the parking area, and then that secured fence area. So that has an asterisk next to it because we got to really define where the edge of that field goes so we can make sure that we've got adequate security there for the children. Let's see, I think it's about it. So that's the entire presentation. Chelsea, I don't know if you would like to bring up anything else.
This is a very exciting project for our little town and our little community. I believe there's about 100 kids. I actually grew up on Fort Myers Beach myself, so this hits close to home, so really exciting to be part of a bigger project. We are working with Lee County. We've got Fort Myers Beach Little League, we've got the town, you all. There's a lot of players in this project, and so far we've had a stakeholder meeting, and there's consensus from our community that we want to move forward with this, and that was solidified this past Monday when council decided to move forward with the $10 million loan. So we'll look to you all. This is really a two-part with the school district. It's number one, acquiring the land. That's really time sensitive for us in the acquisition of that loan. The second part of that is a shared use agreement with the school district for the larger parts of the recreation center and coordinating those efforts to have additional amenities for the children of Fort Myers Beach Elementary. So with that, I guess we'll open it up for any questions, or if Kathy would like to take.
Yeah, I'd like to clarify a little bit when we talk about the interlocals. So there's 2 interlocals that will be coming forward to the board in the coming months. The first of which is slated to come to our next board meeting, September 8th. That is the one that Chelsea just said that her board has already approved. That interlocal is a preliminary interlocal. It sets up the requirements for the next interlocal. This interlocal was required by the town in order for them to secure their funding. So the bank wanted some assurances that we would be working towards a secondary interlocal, and the secondary interlocal is really where the meat of the agreements come in play. That's where we identify exactly what property is going to be transferred between the 2 entities. It identifies exactly how the shared use of the facilities will work. One of the shared uses that Paul didn't talk about is they have a covered play area that's used by our students as an after-school program. It's, I believe, in the orange buildings. That will also be part of the shared use agreement so that we can maintain use of those facilities as they get renovated and upgraded. And exactly how that agreement works, there will be our stipulation that what the school will be doing is by June 1st of every year or July 1st of every year, we're still working exactly which date is more preferable for the school. They will provide to the town the dates and the hours that they need the facilities available to the students for the upcoming school year. And then the town will have a chance to reply, and by August 1st of every year, we will have set a schedule for the coming school year. So all of those specific details will come in the second interlocal. Because they're still working on their site planning, we couldn't get those established in this first interlocal, but because they needed to get into the financing of it, we agreed to do an interim interlocal that it sets up a promise for us to work with the town as we get to that final interlocal. But we have some date certains in the final interlocal. We need to see a draft by December 31st. And then we have 30 days to solidify and bring that agreement to the boards for approval. If we don't, there's some stipulations on how we can extend that date a little bit, but we did not want this to just be going out there forever. We wanted some date certains as to how soon we would wrap up that second interlocal. So when you see this first interlocal, it's going to seem sort of nebulous to you, and that's done on purpose because there's still a lot of things that the town has to figure out before we can confirm those and memorialize those in a final interlocal. But because of the financing requirements, they're trying to get their loan established before September 30th. We agreed to do this interim step.
Okay, Ms. Ebal, I just have one question. So what you just spoke about, the June, having our needs put out there in June, that's what you were speaking about as far as scheduling, what would be scheduled?
Yes, that's.
They make the deciding factor of our usage?
So what will happen by either June 30th, either June 1st or July 1st, we're still, again, working on the final details of that with the school, is it will set a schedule for all shared use areas. So anything that is a shared use area, the purple areas basically that we talked about, as well as the covered areas, any of those, there we go, the areas that are in pink. So you see the buildings down on the bottom as well as the field space. Those areas will be determined in a schedule of use that will be solidified by August 1st of every year, but it will be initiated by the school. The school will be the first one to say, these are the dates and times that we need to use the facilities for the coming school year. So every year we will do this. And we wanted to, since we are donating a significant portion of the land for this project to happen, we wanted to make sure that we maintain the control as to when that schedule happened. So it's in our court first.
So we assume that once we put that schedule out, they're going to agree upon it and we're going to move forward.
Well, we assume that when we get the first step to give them the schedule, that they may have some comments for us, and that's why the August 1st date. So by August 1st, we have a solidified date. We put out a first set, they provide us any comments, and we have till August 1st to make any agreements.
Okay, thank you. Ms. Gittens?
Okay, just to first grade level here to make sure I'm understanding. Mr. Bendy, on the one that has, it's like 3 or 4 slides down, and you have the 3 pink sections, go back up, that one.
Yeah.
Okay, so those are the properties that the district owns?
Yes.
Okay, so go to the next one, and you're saying, though, that yellow piece, is that one that we own as well?
You do not. That's right-of-way. That's controlled by the town at the moment.
Okay, so the swap idea is that we give them use of that.
The swap is the light blue goes from Lee County School District to the town.
To the town.
And the yellow goes from the town to the school district.
To the school district, and yet the blue is going to be accessible.
Yes.
For activities, et cetera, et cetera.
Yes.
That's the reason for this interim interlocal, because we haven't yet been able to get a survey crew out there to define exactly where these property lines need to be drawn. So we will create new property lines that encompass the pink and the yellow. That will become our property, and the blues will become the property of the town. And then the schedule that we talked about, that is the pink area that is available for use from the town to us. And likewise, there'll be a schedule that allows the use of our facilities to the town, and that will all be defined in that schedule.
Okay, and then the next one down from that has the purple and the brown, is that purple area the same as the yellow on the slide above, or am I looking at it wrong?
No, they're different. They're different sketches of different things. So the yellow area on this plan right here is
Right.
just showing where the existing parking is and kind of how the new parking lot will lay out on top of it.
Okay,
The-
no, I meant the yellow on, that says the town swap to us. That's encompassed in that next slide that's the
Yes,
purple one?
yes.
That's what I was wondering. Okay, now, the fencing and the security between the purple and the brown on the next slide.
Yes.
Yes. So how, I mean, is that going to be paid for by the town?
Yes.
And then also, it still creates a security situation for the school to have to maintain security of that. And I don't know if that's a school thing, but how do we maintain that if kids are going to be out on that purple area?
So
Do we need more SROs, or what happens with that?
No, so there currently is a perimeter fence around our school that includes it uses our property, our school buildings really as a buffer. So the buildings themselves are part of the secured area, and then there's a fence that goes around the parking lot, around the play field, and to those backwoods, which we already have an agreement with the town for the town to use those facilities when our students aren't using those facilities. A new fence will be put up in that area with a secured gate, and this time, currently, it's a manual gate that allows for the open and closure, so we have to manually open and close that gate. The new gate that we've talked about will be electronic, so there'll be electronic timing on those gates for the opening and closing of the fencing. So this will not operate, the shared use part of this will not operate any differently than it does today, except that we're looking at electronic devices to do the open and closures rather than manual, which is what we have today.
Okay, so the purple now is already shared. Okay, all right, thank you.
Thank you. Is there, Ms. Patrica?
So we're giving them land. You use the word swap here, but
Yes.
we're giving land to Fort Myers Beach. And I understand that we have an MOU coming forward with details in it. Is one of those details, do we have a clawback in the event that 5 years from now, they stop giving us use of the property, or they no longer allow us to operate before and after school care there?
Yes.
Okay.
Yes, I think you're aware that we had some questions about that come up this summer, and you asked us to make sure that as part of this agreement that we would have a recidivism, if I said that word right, clause in it, and we will.
And then in terms of the scheduling of the use, will we get priority during school hours?
Always.
That will be part of the agreement?
Yes.
Fantastic, thank you.
Are there any other questions, please? Ms. Vaughn?
Yeah, part of what I was going to ask was what Ms. Patrica was asking, because facilities are facilities, but land's forever. What's the acreage?
That's a great question. I should have that information for you. The entire park is approximately 16 acres based on what I'm seeing here.
But the acreage that you got, that Fort Myers Beach currently owns versus what we own,
Yeah, so let me back up here real quick. As you can see, there's lots of different parcels inside of this. The entire area in blue is approximately 16 acres, so if you'll estimate with me, let's say a third of that, so maybe 4 acres at the most, is in the pink.
I'm just asking for, how many acres do you have that we're swapping?
The acres to acres?
Yeah, in acres.
You're looking at approximately 1 acre versus 4 acres. So 1 acre in the yellow compared to 4 acres in the blue.
Okay, and one other thing is the town of Fort Myers Beach and the kids, since we're doing proximity, the kids that would be going there, is that a pretty built-out area that we don't anticipate anytime?
Yes,
it's 20 years or so to have to expand the school?
We don't expect any expansion of the school. This is a built-out area. The only development that happens on the town, which happens fairly regularly, is redevelopment, not new development.
That's what I was thinking.
And we have actually spoken to the school about as we've been working with them, Principal Manzi has been amazing to work with throughout this process. And she and I have had the opportunity to meet with Chelsea on a number of occasions about various components of this project, including making sure that our students have access to the covered facilities for this coming school year for aftercare. She and I have talked about how to work with the town, and Chelsea has talked about how do we ensure that this campus continues to be a thriving campus for the citizens of Fort Myers Beach. It is one of our smallest campuses, and yet for the community itself, it's a valuable resource, and we've been talking about how to make sure that it continues to be a valuable resource and provides for the students' needs. I think, aren't you a graduate?
Not a graduate of Fort Myers Beach Elementary. I moved on the island just after.
I know people that are graduates.
I don't want to appear wrong. I think it's a wonderful partnership. It's the kind of partnership we really need to encourage. But on the other hand, we just need to make sure that, and I guess what Ms. Patrica was saying, that I'm not sure what kind of it's a contract or.
So
I don't know, since it's the first time I'm hearing of it, what exactly will be our guarantee that the town won't decide in a couple of years, we want to do this instead?
So this is being done through an interlocal, and an interlocal is a contract.
Yes.
And it provides us opportunities in the contract that if either party either chooses not to continue in the contract or otherwise to make us whole. So that, exactly how that will happen, how we will be made whole, because obviously in this case we are donating land that is being developed, so it's going to be very difficult for us to be made whole in other ways. There'll have to be some way that we work with our attorneys and their attorneys to determine that. Again, that's why we're doing this interim step at this moment, is we are putting in an interim step just to make sure that we do thoughtfully consider this final document. We have about 5 to 6 months to complete this document, and these are issues that we need to make sure.
I just wasn't familiar with the term interlocal.
So we have a number of interlocals with multiple jurisdictions, and an interlocal is a and Dr. Atkins, please chime in but an interlocal is a higher step than an MOU. An MOU is kind of a promise. It's a handshake.
I know MOU, but I didn't know interlocal.
Yeah, and interlocal is like handshake. It's a, yes, we agreed that we're going to do something, but there's really no teeth to it. An interlocal is more of a contractual agreement between two entities that says, yes, we're going to agree to this, and if we don't, here's steps that make sure that those parties agree.
I like that much better than a handshake.
Yes.
Okay, Ms. Fisher or Ms. Giovanelli or Ms. Morgan, any questions?
Ms. Giovanelli.
Okay, Ms. Giovanelli?
Thank you. I think this is an awesome plan. So we're going to get a new playground, and you're going to get a new baseball. Is it going to be like more of a baseball field? Is that what you're going to use it for?
Yeah, so right now it's designed as a multi-purpose field. So baseball would be one of the primary usages, but also you can throw soccer, football, a lot of other sports on there as well. And that's really the goal, not just for the town, but also for the school district, is those kids can come out for PE and use a really nice field that's got more flexibility than the current baseball field that's out there now.
Right. So but the district will be maintaining those fields? That's what or they will?
No.
Okay, that's what I wanted to know.
The town maintains all of it.
Okay, so,
Including the new playground.
thank you. That's what I wanted to get clarified.
Okay,
Thank you.
Ms. Gittens, do you have one more question?
I just wanted to say, I know at one point it was rumored, and I say that with big, marks, that the enrollment at the school was so low that there was consideration about, whether it would remain. So just making sure, and I think you're covering that by saying the agreement would show that if our enrollment continued to drop and it did not remain, what would happen?
We are not, no, I'm sorry, Ms. Gittens. The current discussion does not assume that that would be a part of this agreement. That would be something if there was ever a time that the district decided to do something different with this school other than a school, that would be dealt with differently. This does not set the stage for such an event to happen.
But I'm saying if it did, I guess I'm just saying what would happen.
We'd have to determine what we would do at the time. That is not something, we are not assuming in this agreement that the school will be anything but a school for decades to come.
Okay. All right, thank you.
Ms. Patrica?
Yeah, you said we're swapping 1 for 4, not 4-0, right?
Yeah.
We're swapping
Yes.
one, all right.
Sorry for the mask.
No, I know, and that's why I clarified it, because when you
And that's rough numbers. I can get those numbers for you if you need them.
When you said it, I thought I heard 40, and I was like,
No.
but.
No, the entire thing is 16 acres.
Good.
1/6.
Thank you.
Good. Oh, Ms. Fisher?
Yes, so I just have one question and then a comment. What's the anticipated length of the interlocal agreement, the contract?
99 years.
I'm sorry?
99 years.
99 years, okay, great. Well, I think this is an awesome partnership and a really good way for us to further cement ourselves into the community and benefit not only our students, but the entire Fort Myers Beach community, which is one of my favorites. So I really appreciate all the work that has gone into this. Thank you.
Thank you. Well, thank you so very much for being here today. We really appreciate it.
Thank you.
Thank you for the opportunity.
And then,
Thank you, guys.
Ms. Siebel, I believe you're going to stay there, right?
Got me for the rest of the afternoon, I think.
I'm going to keep you there.
I just happened to be looking at the Davis Demographics was doing some projections and forecasts, and it does appear, at least into the foreseeable future, that you're going to have a fairly stable population out at Fort Myers Beach Elementary. So that goes to 2029.
Great. Thank you for checking that.
We've talked, I mentioned that as part of this, we've been working with Ms. Manzi on other ideas. We've talked about reaching out to the business community and providing information to this business community about what a great resource they have for their employees to potentially have their kids go to work where they are. So we've talked about ways to tap into non-resident populations of students. Okay, so the next thing on your agenda is our monthly capital project update. I'm sorry, I'm not as cute to look at as Scott. But I'm going to fill in for Scott this month because Scott is a little bit under the weather today.
Oh, we have confidence in you.
Thank you. Everything I know, Scott taught me, so I have confidence in Scott's ability to teach. So quickly, we have our HVAC and energy projects. We are on schedule and on budget on all of our projects. Tina Silcox is our manager on that. Gateway High School, I know that if you've driven by Gateway anytime soon, you just can't believe that we are so quick into this. This campus is coming together amazing. We are on schedule. This time next year, we will have students in that school, and I couldn't be more excited about it. There's a close-up building of Building A, Building B with some kitchen work and tile work, and the rest of the campus. But sports lighting is up. The sports facilities are under construction. This is just amazing. The roundabout has been constructed. And we are equally excited about MM. If you've been up to MM, you now know we have walls. And again, this time next year, we will have students on this campus. It's just awesome. And we cannot wait to bring these new facilities to our East Zone and Lehigh Acres communities and Gateway communities. It's going to be quite a resource. Our portables, as you know, we are opening next week with Lehigh, the beginning of Gateway High at Lehigh High School. So we have a portable campus on that campus for them. All of our canopy projects from this summer are complete and done and beautiful. We are halfway through James Stevens. This project is our new pre-K center at James Stevens. It's renovating 2 buildings that were intermediate classrooms on this campus and making them into a pre-K center. This will open after winter break. And then we have some other projects we've been working on, some freezer, cooler, and dry storage projects, serving line food service projects. This one is the Fort Myers Middle one. I know this was being something that the board really was hoping that would happen this summer, and if you get a chance to go to this campus, you will be amazed. It looks awesome. Mirror Lakes had a kitchen remodel as well. There was a serving line renovation at Diplomat Middle, as well as J. Collin English. And then we did some IT tower work at Pinewoods and Littleton, Gateway and Hancock, and roofing projects. We are working on an amendment for Cypress Lake High School. We are working through the contracts at LCPEC, this building, and we are working on the contracting and securing the work to get started at North Fort Myers High School. And this summer, we also completed some tree line project, or some traffic improvements at Tree Line, expanding the parking, creating a new parking lot, and really what needed most at this campus, improving the parent pickup line. We also did some traffic improvements at Diplomat and River Hall, Three Oaks, and that's it. Questions?
Well, I will have to tell you, I did go to Fort Myers Middle, and thank you. That cafeteria is beautiful with the open windows as a wall, and then the kids can actually go out and sit outside, so it's really exciting. Everybody at the school is excited about that cafeteria and the opportunity for the kids to have the cafeteria to eat in, the outside area. Well, actually, they're even going to use the gymnasium as an area for the kids to eat at. But it was a long time coming, but they really did an excellent job. Really, really nice. So thank you. Ms. Gittens.
First of all, I want to say thank you for all the stuff that's going on as well. The canopies are actually very, very, very nice.
They are.
I went over to Gateway's staging, the portables.
At Lehigh Senior?
At Lehigh Senior. I mean, and I took pictures and showed everybody. It was really, really neat. I mean, the concept of a portable, of course, we don't like, but if you have to, it's very, very nice. I mean, the wide area to walk, and how they have the staging kitchen on one side and the other side is where they eat. And I don't know if that was a result of having to do COVID, or is that what was planned in the beginning?
It was always planned that way.
Okay, but it works out well with the COVID thing as well. So that is very, very good. One question about the kitchen renovations that goes back to an earlier discussion about the handing out of food, that there's like one school that will give food for 2 or 3 schools. And the issue is, where do they store? Because from my understanding, what they're doing is, if you're in Connect, you come and you'll pick up food for 5 days. And that's a big bunch of food. And especially if you're doing that for not only your school, but 2 or 3 other schools. And is there storage available?
And I guess, if I may, that's probably something that Ms. Ebaugh probably cannot answer, because she's in construction, so that would be something that we would need to ask Dr. Atkins to get that information, because I don't think it's on.
I'm not sure if Dr. Desamore knows the answer.
Well, I'm just asking too, with the kitchen renovations, was there expansion of like their storage and cold areas and that type of thing?
Yes, in some instances, yes, but yes, storage was definitely a consideration as we picked the sites where feeding would happen, because there were some sites where we didn't choose to utilize because of the storage, or if we utilized the site, we knew we could only do, a limited number of schools out of there because of the storage at the facility. So Did that answer your question?
Yes, it does. Thank you.
Thank you, Ms. Gittens. Do you have some more?
Nope, done.
Are there any other questions, please? No? Thank you so much.
Are there any questions on the change order this month?
On the what?
On the change order?
Change order? Then I'm really excited most to,
Well, we do have a question from Ms. Giovanelli.
Finish.
okay, well, no, I was going to move on to the next item.
Oh, I just wanted to say how exciting I am to see the change in Fort Myers Middle as well. So that's exciting because it was very small.
Yes.
So I know now that it's might be a little bit premature now, but we may have a smaller school, but students. But in the long run, it's a great change. So thank you.
When I started my job last year, on my chair when I walked in were a number of notes from board members, which I thank you for. Never got to say thank you, so thank you. And a document that I had worked on at a previous position that said, "Can't wait to see this."
Yes.
That document was a capital improvement plan from Dr. Atkins, and I was like, how did he get that? So I am really excited. I wish Cindy Brizuela was with us today because she's really the author of this document. But unfortunately, she is on sick leave today.
Very distracting.
But I'm excited to present to you our first ever capital improvement plan. And I don't know if Dr. Atkins wants to introduce this item.
Well, thank you. And I'm excited as well. That is true. I mean, one of the things that it did excite me about her when she applied for the position was the experience that she had doing this in her previous district. So I think what the document that you'll see today is something that we've needed in our school district for some time. I think that you as board members, this is something that's great for you to refer to when you're speaking to members of the public about our capital projects. It is great for school leaders to have when they're planning into the future and they can talk to their school constituencies. This document is going to continue to evolve, but I think that it's loaded with a lot of great information, so I'm excited that the team has put this together, and I think you will be as well as she takes you through it.
So I'm going to start by saying this was a draft, and in the future, you'll get this draft a lot earlier than right before school starts, but things being what they were this year, we wanted to make sure you got a draft. If there are typos, if there are formatting things, if there's any kind of just wordsmithing review things that you would like to see changed, I'd rather not go through them here at the dais, but if you would like to send us your comments either on a hard copy, if you'd like a hard copy, we can certainly get you one. If you want to send it to us via email, however you'd like to get those comments, before we bring this back to the board for final adoption, we will make sure to capture all of your wordsmithing or other context formatting review changes. So rather than having you tell me where they are at the dais, if you can just send us to those comments, we're happy to capture those. That said, I'd like to walk through the document with you. Some of this you've seen before, so I'm going to skim through those sections. Some of it is new to you, and we'll spend a little more time on those sections. So most of this introduction talks about demographics and population and capacity issues. We've talked a lot about these. We had a full presentation a number of months ago on this issue. We've also sent you information about this in board memos. So I'm not going to spend a lot of time going through this. If you have any questions about it, I'm happy to, or Dominic is happy to answer those, but I'm going to skim through them just to kind of show you that there they are. These maps were all done in-house. If you remember correctly, we hired this year a GIS planner, Courtney Gordon, and she did all of these maps for us, which is a great resource for us to have in-house because now we can do this work right in-house. These goals, once again, we selected 5 goals: capital improvement strategy, educational services planning, asset maintenance and preservation, safety and security and technology. These were goals that you told us were important as we did capital planning. We did this back in October. So this document reflects the interests of the board. We use these goals along with the values which you worked with us in December, as the basis for our decision-making. So all of the projects that we are presenting in this capital plan came from you. We based and evaluated our projects based on what you told us was important. And then the final component of that was our big 5 priorities, which come from Envision 2030. So these 3 documents were really the basis of how we decided if a project should be pursued further for funding. Planning considerations, this is a new section that these are issues that are in the planning world that will affect how we build schools. As we know, Lee County has a number of platted lots, mostly in Cape Coral and in Lehigh Acres. They are a major planning issue for us because unlike a planned development that comes in, we have no phasing on these projects. We don't know when these homes will be built. We just know that at some point they will be built. So we really have to monitor these communities in a much closer way than we do, say, a Gateway, because we don't have a phasing. We don't know a timing for when that development will happen. We just know it's out there. Some other major issues that are in here, obviously the proximity project, which we've talked a lot about, which will definitely change how we plan for schools, how we locate school, where we build schools in the future. The sales tax initiative. The sales tax initiative allows us to do a lot of the projects we have in this plan. However, COVID is going to change that, and we're going to have to very closely monitor what the impact of COVID is on our capital plan, and it may impact how successful our plan is in the future. And then our economic centers, understanding that Lee County is a county that's built on commuting patterns. So where do people live? Where do people work? And how do, that we just talked about that with Fort Myers Beach. How does that impact where students go to school every day? And then coordination with governments. We just had a good example of that earlier today. We try our best to work with our government partners to make sure that all of our public resources, no matter who owns them or who cares for them, are being used by all of our citizens. So we work hard with our interjurisdictional partners, and in the coming year, you're going to see a couple of updates coming up. Our joint use facility agreement with the county is set to expire in just 2 months. We are working also on a new development services agreement with the county, as well as other jurisdictions, and we're also working on an emergency management interlocals. So in the next year, you're going to see a number of interlocals come forward to you that need to be either updated or just revised, because it's time. We are in the process also of developing a condition assessment tool. This condition assessment tool, what we call the facility index tool, or the FIT, which we will present to you hopefully sooner rather than later, is a new tool for us, and it will be the basis by which we can determine projects, the assessment of a project. How well is one campus versus another? Why do we pick a campus X versus Y to work on for the same project? It'll be based on a numeric assessment of that campus, a real defined way to understand what the condition of that campus is, based not only at the campus level, but all the way down to the actual facility within the campus. And then finally, we're in the middle of storm season. We dodged a bullet this weekend. Unfortunately, it doesn't look Louisiana's going to be so lucky. But it's always something that we have to think about, knowing that we are low elevation in a high threat zone. So how does that impact our planning efforts? And then Chapter 3 talks about enrollment trends and capacity. Again, we discussed this a number of times through the year, so I'm going to skip through this section. I'm going to stop here for a second just because I think this map is really cool. All of these dots are students. So this gives us a really clear definition and easy way for us to identify where are our students located, and therefore where should we locate schools. And we did one of these at the county level and then by elementary, middle, and high school levels. And then these are capacity maps. Now we get to the meat today, our projects. First, I want to stop and talk a little bit about what the 5-year plan is and how a 5-year plan is developed. Anything that is in year one means it's a funded project. That's a project that's ready to go. We're ready to put money into it. We know what the project is, and we're ready to start it. If it's a year 2 or 3 project, it's a planning project that we know is moving forward. We're developing the scope with it. We are working with Adam Malloy to do community involvement, to understand what the community wants from that project. We're working with the principal to understand what the principal wants with it. We're working with maintenance to understand the maintenance conditions and the facility needs of that campus. We're working with budget to understand what the budgetary implications for that project are. And we're working with construction and design to get a really good number on what that project is going to cost us. That's what we're working on in years 2 and 3 as a team. And again, this is an intergovernmental or interdepartmental team made up of almost 30 to 40 people from academic services, from business services, from IT, information services, and from operations, and led by Dr. Atkins. And then years 4 and 5 projects, those are projects that are out there that we think may develop into something, but they may not. You may see a project that's in year 4 or 5 that just drops off the radar, or it just stays out there for a while because it really hasn't, we think it's a good idea, but it hasn't matured to the idea, to the point at which we're really working on it in a very concerted effort. But the most important thing to understand is anything from year 2 to 5 can change. When it gets to year 1, then that project's a go. So here are the projects for this year. And I'm just going to click, this is a summary. Melissa Rivera from Business Services did a really great job of helping us develop this tool. It takes all of the various budget documents regarding capital planning and moves it into one document that we can easily reference. The first section talks about various revenue sources. The second section talks about different department operations and payments. And then the final section is all of our capital projects that are highlighted in the plan. So at this, and please feel free to stop me at any time, but I'm going to go a little bit slower now and walk through the projects that are being selected for this year's 5-year capital plan. The first one is Bonita Springs Elementary Restroom. This will add 2 bathrooms to the cafeteria on the west side where none currently exists. So there is not a restroom right now in the vicinity for these students. We deemed it a very important project. It's funded in years 21 and 22, so it's a years 2, 3 project with the intent to open and complete this project by August of 2023. So it's not funded this year, it'll be funded next year is the goal. And you can see which goals and which values this project meets. I'm going to go slowly. If there are questions on a specific project, stop me at that time.
Thank you.
The next project is Cypress Lake Middle School campus. This is one of our 2 Castaldi projects, one of 2 of our rebuild projects. We are in the process, as you know, of working with the state to get this Castaldi completed. They asked us recent questions. We have submitted the answers to those questions, and we are now finally awaiting our final answer, which we expect to be a yes, except for potentially this building right back here. This building, if you can't really tell my cursor, but it's the building on the southeast corner across next to the gymnasium. It's a classroom wing. It's about a 20-year-old building. And so because of its age, the state, it doesn't fall within the traditional guidelines of the state. And so the state has talked to us about maintaining that building. We've tried to convince the state because of site elevation issues and cost of materials that we should be allowed to include that building in part of the entire project, but that building may stay. We'll have to see what happens. This is one of the projects that we're working with Adam on a community effort to understand what the community would like to see with the rebuilt campus.
I'm sorry, is that for the Cypress Lake one?
Yes.
Okay, thank you.
Cypress Lake High School, sorry, this mask gets. Cypress Lake High School is one of our, the science wing is one of the 2 science wings we have listed in this plan. It's a $3 million renovation of a science wing. There is a rotational project that the academic services is working through on the various science wings, and this is the next one up. The next project is the District Atlas Refresh Project. This is an upgrade and replacement of classroom interactive and AV systems, including whiteboards, audio enhancement, and related equipment. It's a 5-year project at $34 million, or about $35 million total investment. The electrical upgrades is another district-wide project at about $1.5 million. This upgrades all of our electrical panels, and specifically Villas Elementary, Tropic Isles, Orange River, Pine Island, and Riverdale High School. The next one is our district HVAC projects, a 5-year investment of $80,500,000. And in the project description identifies the projects we have identified for the next 5 years: Orangewood, Success Academy, Spring Creek, Bonita Springs Elementary, the Sanibel School, Gateway Elementary, Hancock, Allen Park, Cape Elementary, Fort Myers High, Patriot Elementary, Challenger Middle School, Mariner High School, Island Coast, Cypress Lake, Edgewood, Franklin Park, LCPEC, and Riverdale High School.
Ms. Ebo, can you please tell me, on that, you have Cypress Lake and you have Franklin Park, and they're the two that are going to be rebuilds. Would that not be included in the price of the building versus here?
It will be done at the same time, yes.
Okay, thank you.
Yeah, I mean, one of the things we're looking to do as part of the FIT tool is to better understand and better align our projects so that we're making sure that things are being done coincident. The next one is district property purchases, a total 5-year investment of $26 million. As I said, one of the things we're doing with the proximity plan is really identify where these properties ought to be located in relationship to where our students are. I think we all know that some of our current projects or placements are very close to one another. We're looking to spread them out in a better location to where our students are, so that we can create more neighborized campuses. The next one is $27 million investment in roofing projects, district-wide. In the next 5 years, we plan to do North Fort Myers High School, Cypress Lake High School, LCEPC, the Central Warehouse, Fort Myers Tech, Bonita Springs Middle, Cape Coral, Hector Cafferata. The next one is a 5-year district technology upgrade at $62 million. This will upgrade and replace computers and peripherals across the campuses.
Can I ask on that one, on the technology, is there an order? And I know previously we used to look at how old the equipment was, and, you know, you had to replace and kind of in a area. I'd see Trey standing up, so.
Yes, good afternoon, Board. So just to answer a fantastic question, we work off of a 3-year refresh if we're specifically targeting the Chromebooks, because we have our warranties, service and support wrapped into the cost of the Chromebooks. This year here, this past summer, we just wrapped up our elementary refresh. Middle will be next, high school will be next, and it repeats. And that's how that works. Then, of course, you break down into 3 to 5 year warranty for, you know, workstations, for example, in labs, like you would for Adobe classes and so forth. So that's how that works.
And I, years ago, when I was, you know, teaching technology, there was the question about, you know, a new school is built and they have the latest technology. So is this to counteract that? Because there was always the question that the ones that were behind were always behind. So does this take care of, you have a new school, then you go to the oldest and the newest and the oldest that way?
Well, yes. So there's a cost, actually, if you were just to, let's say, remove certain equipment out of one school and do that across an entire district. It becomes very costly to maintain systems outside of a refresh schedule like that. Now, the actual FF&E budgets and all that are used for populating a new school with technology, it's a little different factor because it's a new build from the ground up.
Okay. Thank you.
You're welcome.
Please.
Next is East Elementary J. This campus is adjacent to the MM school, what will become Lambs. It's a $53 million investment in a new elementary school in the East Zone in Lehigh. It is scheduled to open August of '24. Next is our East Innovation. It's a pre-K-8 school. It's a $75 million investment scheduled to open in August '24 and also scheduled to be open in the East Zone.
And can I ask a quick question about that? Going up to the slides of the property, I think it was number 47. Are those the potential locations for this school?
We haven't yet identified the location for the school.
Okay, thank you.
Fort Myers Middle is a cafeteria. This is an expansion. This is a project we just talked about. We've already completed it. It was part of the summer projects. This was a joint funded project both with USDA Food and Nutrition Funds as well as $300,000 investment on our part. FMTC refresh. This is a $10 million investment in the refresh of this campus. This is based on one of the superintendent's Big Five, meeting the Envision 2030 goals for future resources for workforce employment and technology training. This is going to be a phased project. This year we will be doing the design on the project. We will break ground next summer and it will be complete by August 23, but the campus will stay open. It'll be phased over time. So we'll be working on one building while we're working on another, and then we'll work on another while those other parts of the campus remain open.
Does this increase capacity at all there?
That's part of what we'll be working on in the planning. Dr. Spira, do you want to elaborate at all on what we're thinking about on this campus?
Yes, one of the goals certainly is to increase capacity and to make our programs at our technical colleges current with what the job market needs are. And so our directors have been involved with this project, with not only with Kathy, but Rita Davis has been involved in this also. So increased capacity and making sure that the facilities are also representative of the experiences students will have in the workforce. And so really updating the facilities to make sure it's more relevant.
So I think I have a good feel for capacity at the various schools across the district, K-12, but I don't have a good sense beyond believing that we're at or above capacity in a lot of our technical college programs. So will this alleviate that, or are we at some point considering an additional technical college in the district?
So this would not alleviate that. There's certainly a waiting list trying to get into these technical colleges that we have now. So it's really to look at the current demand. I know we've had, let the superintendent talk about that. Certainly we've had conversations about expanding opportunities in the area of technical colleges to other parts of our community.
One thing about this particular refresh, it does look at the existing facility and allows for expansion of some of those more popular programs, welding as an example. If you go there today, I don't know if you've toured the welding facility there, but it's just poor compared to, let's say, even the one at South High, and this is the technical college. This would allow us to use that facility and expand things like auto mechanics, move major appliances into the other building that you see actually down there, I believe in the front there with the pillars. So it would move it back there, and I can't remember the capacity change, but I want to say 200, but I could be wrong. Don't quote me with that. We can get you that number. The other thing is, as you know, we do want to expand into the East Zone. So this would be the expansion of Fort Myers Technical College into the East Zone, and we're currently working on that. I think it's a little bit outside of this 5-year plan, but it is in the near future. So do this, Cape Coral Technical, and then the expansion.
Okay, I didn't realize that the expansion out to the East Zone would be like an additional Fort Myers Tech campus. So that helps me to understand the plan better. And it is something we're envisioning in the foreseeable future. Excellent. Thank you.
The land for the Fort Myers Technical College campus in Lehigh is part of the property purchases in the 5-year plan.
Excellent. Perfect. Thank you.
So it's on that slide that you showed us, it's one of those?
We have yet to identify it yet. All I'm saying is that we have, when we budgeted what we would need for the 5 years for property purchases, we included the land that we would need to purchase in Lehigh Acres for a technical college.
And I'm sorry.
Ms. Vaughn?
Yeah, this is just a thought that struck me as we're talking about this. Obviously, in the technical colleges, as we build some of these specialized areas, they're at a cost, obviously, a lot more than just a regular classroom. So I'm wondering if we are thinking about, a lot of school districts will do, we have our academies, but so not to duplicate an expensive academy room at a certain school, that we, as we move toward the proximity, that we kind of pair up some schools or, go into the idea of more vocational career schools, not for dual enrollment and for the older student, but for our regular students. Are we thinking about that? Because I'm just thinking about the cost. Does that make sense, what I'm saying?
I'll give a stab at it, and then Dr. Spiro, if you want to add anything additional. One of the things that we are looking to do, hopefully as a part of all of these expansions, Fort Myers Technical College, East Zone, Cape Coral Technical College, is to pair up with academies so that you have a little bit of that, and also provide opportunity for high school students to dual enroll on that campus.
Let me interrupt for just, because right now to go to one of the academies, they have to dual enroll, right?
Right.
But if they're, let's say they're taking welding at, does South Fort Myers have welding? All right. That's not a dual enroll. That's just a program that they have. What I'm saying is, let me clarify, that for students that are not dual enrolled, that would be in our regular academies, I'm just wondering if we're considering using technical college, and I'm just not sure in terms of income, community need. It's just something that popped into my head. If this would be something that we could just use for our high school students that are not dual enrolled, because certainly we're talking about moving to more career-ready students, and certainly we have a lot of students that enroll in our academies, and these rooms, the particular suites of rooms, are very expensive to build. So why are we duplicating, if that makes sense?
It does make sense, and I was laughing at Kathy because this is nothing official. I mean, we had talked before. One of my dreams would be to have a high school attached to the technical colleges where students were taking their core academics during the day, and then they are doing the coursework right there at the technical colleges. We've actually had many conversations about that. That is nothing in the 5-year plan, but I understand what you're talking about, because I think that provides opportunities for students in the future beyond the academies. So no, it's not part of the 5-year plans. Yes, we've had conversations about the opportunities for this in the future. So I echo what you're saying.
I'm just going to quit this job and see if you have an opening in that department or something. But no, it just, to me, as I said, it popped in my head, and I'm thinking, not just for the students, but I don't know if you've ever done the costs.
We have not done the cost on that. We had literally, we're just.
What's probably the most expensive, I guess, like at Bonita Springs High School, it's expensive, all the technical for the flight, but in terms of these HVAC, or, I mean, what are the most expensive?
I would say probably auto mechanics, I would imagine be.
Auto mechanics?
I would assume because of the facilities that are used, and then HVAC would certainly come in closely thereafter.
Yeah, the HVAC is really, I know you all have been there. It's pretty cool. And
it's a pretty cool room. Yeah. So a suggestion might be, if you're not already doing this, is to look at how much these specialized, the really expensive rooms cost. And if we're having an HVAC room at Fort Myers Technical College, why would we be building one out in East County or somewhere? Why not use it as academy as well? So not as, and that would also increase space for students that are not enrolled in career.
Yeah.
Just a thought.
See, now you have your second career already ready for you.
You know what? I like the hands-on things. I really do.
So actually, Ms. Vaughn, Dr. Atkins and I just had this conversation recently. I had suggested that we, something to bring to the table to talk about as a board, but if you're 18, there's a lot of 18-year-olds in high school. They could get a real estate license. All you have to have is an instructor, and it's just X amount of hours. So once they, graduated, even, they could go and then just take the test and leave high school with a diploma and take the test. They have to have the diploma, of course. So it's something that would be right in the classroom, not at, it could be at FMTC if that's kind of what the 5-year plan, that was something that I threw out there. Not only that, but like being a home inspector, a mortgage broker, those, giving that education to students that not even aware of those jobs and positions and things that they avail, this is what Lee County is. We're in that kind of business, service industry. So, and even a contractor's license. So it's something that could even be a step two before finishing up at FMTC. He was going to work on that and what that would look like. And then I was hoping to bring it to the board and talk, do we form an actual committee with business partners? What do they want? I mean, we know the needs there. We know that the input's there. So what does it look like for our next, our next high school? I mean, it could be Gateway, or it could be whatever the board decides. But I thought that, a real estate license is pretty simple to get, honestly. It's just the hours and then taking the exam. And it's opportunity that a student could graduate and join another team, and because there are lots of real estate teams these days that do a little piece of it, So it's opportunity. That's a job that's ready to go. We could, so that was my thought, and we actually talked about it at length, because I've also been talking about, we need linemen, and if we educate and train linemen and send them now to New Orleans, they would be, they make a lot of money, and it's opportunity to have our students prosper by having that ability, in education. So that's something that, and I thought I think it needs to be a committee, though, of our outside people and deciding what looks good for Lee County, and making that. So that's something so I'm glad you mentioned it. Thank you.
Thank you.
She did make that suggestion, so we're kind of ruminating on it right now. I do think it's a great idea. It's part of the Big Five. It's part of your Envision 2030 in terms of career and tech ed. So maybe a workshop in the near future, but we'll put our heads together and bring something forward, because there are a lot of great suggestions, and we think if we had a good process to vet them. We do have, these committees that are ongoing at our schools, but maybe an overarching something that the board could become involved in would be helpful.
Okay, so we'll put that down in the parking lot.
Yeah, I was going to add it to the list, but
Yes.
it's quite long.
Ms. Yvonne?
So again, this project, this year, we'll be working on the design and planning for this, so this discussion today has been very helpful, because we can, Dr. Spire, we can take these comments and incorporate them into our planning work, and then you'll see groundbreaking on this starting next summer. Franklin Park Elementary rebuild, this is the second of our two Scastaldi projects. Again, this is one that we are working with the state right now. Again, we have permission for most of this campus. There is one building on this campus, just like there is at Cypress Lake, that the state is talking to us about keeping because of its age. Again, it's about a 20-year-old building. It doesn't fall within the state's normal guidelines. But on this one, we were able to work with the state and help them understand the unique conditions that Franklin Park is, being that being the environment of the campus, where it's located in the city, and the dependence that community has on this campus as being more than just a school. And because of that, they gave us the ability to work with the community to develop letters of support for this campus and really look at that building not just as a building that costs to renovate, but what is it about this entire campus? Usually a Castaldi does one thing. It evaluates how much does it cost to maintain the building versus how much does it cost to rebuild it. It's that simple. It's that kind of equation. It is a strictly numerical equation that the state does in order to determine whether or not they're going to give permission to a local jurisdiction to renovate and tear down a building. In this case, we were able to convince the state that we could look at community conditions, we could look at the community wraparound school, we could look at the needs and the safety and security issues regarding this campus. We could look at the value this campus offers to other redevelopment projects that are happening in this area. And it's because of those that we are very hopeful that the state is going to give us permission to tear down and rebuild the entire campus. Otherwise, it was very clear that that one building would have to stay. But we're hopeful when we get the final word from the state that they're going to give us permission to rebuild the entire campus.
Perfect.
So-
And then also, I don't think I've told you, the city of Fort Myers is going to do like a resolution for that as well.
Right.
So
So we're very excited. We're just sitting right now waiting for the final answer on both of these. And then once we do, this campus as well is slated to open August 24. We're also working with Adam on this project for community involvement. As you know, this is the site of a community wraparound school, which is a grant from the University of Central Florida. So this is a very exciting project, I can't wait to see this come to fruition. And
thank you for all you're doing there too, both of you, Dominic as well.
Gateway High School, we've already talked about. This is the last year of its funding at $48 million. That's just this year's piece of it. It's not the total project. And this time next year, we'll be at Gateway. So James Stephen, we talked about this earlier. This is a 1.8, almost $2 million project to create a pre-K center at James Stephen K-8. The Lehigh Acres Middle School campus. This is what was known as MM. We will be having a topping off ceremony in September for this campus and officially naming it Lehigh Acres Middle School. So Little Lehigh Acres Middle School will move to this campus, providing it a brand new opportunity to rebrand and represent itself to the Lehigh Acres community. This is North Fort Myers Science Wing. Again, it's the second of the Science Wing projects. It's also going to be completed by August 24. And then once we complete these two, we'll go back and determine what the next rotation projects for Science Wings are. The Patriot Elementary School, this is a $300,000 project. You'll note that $300,000 is the kind of the bottom of our projects. Any capital project that was $250,000 or more, we decided that would be the threshold at which we would present it as its own project. Other projects you're going to see we put into a small projects category that's also in the document. This is the one property purchase we put on its own, and that's because this is, Dominic, you want to talk a little bit about this one?
Afternoon, Board. Dr. Atkins. This particular property is 2.2 acres. It's adjacent to G. Weaver, and it's one of the big five. It's where we're going to hope to put our pre-K expansion of 20 classrooms to help. One thing is to get our Head Start portables, our students that are at either Lehigh Acres Elementary School or Sunshine Elementary School, and move them into a facility there. There'll be 20 classrooms. The building would line up to the, I guess if you're looking at G. Weaver from Homestead, it's a 2-acre parcel that's right adjacent to the school on it would be the northeast corner. And it'll actually sit 60 feet away from the main building. It'll have a covered walk that goes into the cafeteria at the main building. So we've kind of done a little bit of pre-planning on the site ahead of time, knowing that what our potential was, what we'll be able to do with it once we get under contract. So the next piece of this is, and it's really not in here because we're purchasing the property, but Early Childhood is working on a whole other project for actually funding the building of this particular facility. So that's the second step. So right now they actually are waiting for their approval for their grant for the design for the building, and then after that, the second step would be getting the funding for the building.
A quick question on that one. Oh,
No, she's just looking to, you're
oh, okay. The question I have is this the area where they have their sports fields now? That's closest by the portables and
We
where?
don't own that property now, so hopefully we're not using it. We own 2 acres that's adjacent to the pavilion and the portables for the pre-K. We own that 2 acres that's there. This 2 acres is behind it, adjacent to the school.
Okay, so there is that parcel still in between the two?
Correct. So if you're at Homestead, you got the bank on the corner?
Right, so it's right behind the bank.
Behind the bank is where
And then the other area beyond the fence is where you're talking about
Right.
adding?
So it's more adjacent to the school. This piece of
Oh,
property.
okay. And wasn't there something about the property behind that, or that was the only property you was talking about?
Well, we own the 2 acres that's right behind the bank, that's adjacent to the play pavilion that's there. There was the 2 acres that are actually directly behind there that's adjacent to the school.
Yeah.
That we didn't own. We do utilize a driveway there for our food service workers and trash pickup. Technically, it's not our property yet.
That's what I was thinking.
We do
Okay.
utilize it to a degree, and we have been for years. But-
So the area now directly behind the bank that they use for their sports fields and all that, we don't own?
No, we do own that.
We do own that, okay. And what is is that where we're looking at putting the, what are you looking at putting on that property? I'm a little confused.
Nothing, that's just the play field. So if you go just a little
So that's not going to be bothered?
Right, so behind
Okay.
it is the bus ramp. where the
Right,
bus-
I get it.
The other side of the bus ramp is the property that.
Is the property that leads right up against the school? Okay, all right, thank you.
Ms. Patrica, please.
I'm wondering whether we have data to show kindergarten readiness by zone and subzone?
I thought I remember seeing that before,
But
that it
I think
does
we do, but
exist.
I can't recall off the top of my head, but I thought we did have that.
No, I don't need you to give it to me today, but if you have it and you can send it to me, or send it to us, that'd be great. If you don't have it, I'm not gonna tax you with that, but it would just, as we go through these pre-K additions, it would just help, in my mind, to be able to make sure we're matching them up with the areas of greatest need for pre-K readiness. Which I'm sure you're doing, I just wanna see it.
Thank you. Are there any other questions?
I have one quick one.
Please, Ms. Gittens.
At one point, we had talked about, partnership with the YMCA in this area, especially with the pre-K and setting that all up. Are we still looking at that?
Just looking at,
Okay, I don't think this is is there somebody here that can answer that, or?
Well, it has to do with property and the same property, so. If you want to get to me later, that's fine. You can get back to me.
we had been working on that, I just couldn't remember that. I don't recall what the latest update on that is, but
Okay, you can get it to me later on. I just wanted to make sure that, were we still on that path to work with them to extend that.
Thank you, Lauren. Kathy, if you want to continue?
And the next one, okay. The next project is one that, again, comes from your board priorities and the goals, achieving the goals. This is the Riverdale campus. This year, we have funding in it for a design project, and because this design is going to be more of a campus master plan, we actually don't start construction for 2 years. So we'll be working on design for about 1.5 years after we hire the consultant, and then 2 years from now, we'll start working on the campus in a phased effort. This project is very much like we talked about, kind of the further you get out, the less you really understand what the project is. This is where this project is. We have a lot of ideas of what needs to happen on this campus, everything from upgraded science wing to providing permanent classroom stations for the portables that are on that campus, to a renovated math wing, to an upgraded gym facility, potentially upgraded cafeteria facility, secured single point of entry, renovated classroom space and hallway space. There's a lot of potential ideas on this project, and that's why we decided, rather than do a traditional design project that takes us about 6 months on a refresh project like this, we would really take the time, do a campus master plan, and figure out what's the best way to improve this campus and start construction not next year or the immediate year after the design, but 2 years from now.
Well, and to include, I know, parking's a consideration because it's already tight there, and it looks like they're going to redevelop the plaza right across the street, which is where a lot of our students park now. So we're going to have to definitely address that issue as well.
One thing we are moving forward with immediately on this project is the purchase of a piece of land that's adjacent to this parcel.
I was going to ask about.
Yeah, we are.
Where is that located?
So if you're on Buckingham Road, you're headed north, you pass the campus, it's the wooded lot immediately north of the campus, directly across from the plaza that Dr. Atkins was speaking
So
of.
if you're going on Buckingham and you turn like you're going into CVS and all of that, down that little road?
Yeah, it's before the CVS. There's a piece of land
But in
between
the back
CVS
of
and the
it.
school. It's there. It fronts on Buckingham.
And then okay, because when you go for games or whatever, sometimes they let you out that way.
Right.
Okay.
But this piece of property is the piece that is between CVS and the high school. It fronts on
And the high school
Buckingham.
itself, okay.
Yep.
And that would be used for parking?
We don't know. Again, that's part of the campus master plan. That's something that when we have all sorts of ideas and considerations and thoughts. We are working very closely with the school community. And once again, this is a project we're working on with Adam to talk to the greater community. Obviously, Riverdale is a much beloved campus, and we want to make sure that whatever we do on this campus is exactly what the community wants us to do on this campus.
Okay, thank you.
Did you have any questions?
Yeah.
I'm sorry,
No,
Ms.
no,
Fisher?
I'm sorry.
No, and I don't have a question. I have a comment. I've been thinking about Riverdale for years. About 5 years ago, when I visited the science wing, I thought and said to Dr. Atkins, we need to do something at Riverdale. So I'm glad to see that at last it's at least on the long-range plan. And if we can do it sooner than 2 years, that would be great. But
I would ditto that, to fast
I
track
mean,
it.
it's a much-needed project, so thank you for getting it out front.
We're very excited to get started on this campus. I think, just to remember, the reason that this project is going to take some time is because we want to be very thoughtful in the master planning of this campus, and not overthink it, but give it the right amount of thought.
Right. Thank you. It's a lot of kids there.
The next is South Elementary K, which is part of the Estero projects that we've talked about, and then followed immediately by South Middle School NN. As you know, we have moved this project to the Three Oaks property. We have already started the design project, and last week we submitted the comp plan amendment that was necessary for this project. So these projects have already started and are underway, at least in the design phase. The next one is Tice Elementary. This is a elevator that needs to be brought to ADA compliance. The next one is Varsity Lakes Middle School sidewalk. It's an expansion of the sidewalk, allowing for connectivity between the campus and the roadways around it. Then we have Veterans Park K-8. Earlier I mentioned that MM is going to become the new campus for Lehigh Acres Middle School. That allows for the expansion of Veterans Park to be a K-8 campus that will encompass both the current Veterans Park and the current Lambs campus into one campus, to be connected by the next project, which is a K-8 Performing Arts Center. It will be located in the middle. This is located in budget-wise in year 5, but this isn't one of those year 5 sitting out there. It's just because of the timing of the project in relationship to the refresh of the other projects. Then we have a high school expansion in the West Zone. It will be on an existing campus to be determined. We haven't yet determined which high school will get expanded, but there will be expansion of a new classroom wing in the West Zone. And that completes the large projects. Then we had a series of small projects. I think you might remember that last year we initiated something a little different, and we will be kicking that off in just a couple of weeks for this year, where rather than have various projects come to us through various means, including board members, superintendent, principal call-ins, however projects were coming to us, we solicited schools and departments to provide us what they would propose for small projects. These are projects in the generally under $200,000, but even smaller, that would allow for improvements to their campus. This is done on an annual basis. We're doing it annually because principles change, priorities change, and so we're going to do this every year. We're going to ask for their input. As I said, we did this last year, and we're going to be doing it again this year. And these are the projects we selected for this year. We had a bicycle cage at Bonita Springs Middle, or Bonita Middle. If you have ever been out to Bonita Springs Middle and driven by their bike cage, you know this is probably one of the most used bike cages anywhere. It is always overflowing with bikes. So we are expanding that bike cage. We are putting in a new door for East Lee County High School that connects a program, so it allows for improved teaching between the two classrooms. We're adding storage shelves to Heffer-Cafferata because they desperately needed them. Again, a new door at Lehigh Elementary, and the big project out of the resource, that's about $210,000 worth of projects, a little over $200,000 worth of projects this year. The big one.
If I may,
Yeah.
Is it $20,000 for shelves? Is that right? I mean, that seems like.
Oh, it's 2,000. It's an extra zero. Thank you.
Okay, I was going to say, that's like insane.
That's one of those typos we were looking for.
Okay. Some good shelves.
Pelican Elementary is getting a new playground at $108,000. This is a ADA project. Raymond Page is getting a new door, and that's all the small projects for this year. And again, we'll be sending out an email very soon to our principals and principals and department heads asking for concepts for this coming school year.
Ms. Vaughn?
Yeah, so are these, okay, they're coming through construction, but some of these seem like almost more of a maintenance issue. I know we touched on this at a prior meeting, or at least I asked a question on, is there a price at a certain cost that it goes to construction versus maintenance when we're talking about the Bonita Springs Elementary and all of that? So who is doing like shelves?
It's probably being done by maintenance. This isn't saying who's doing it. So remember that my title is Executive Director of Facility Planning and Development. So there's 3 primary departments that I'm responsible for: planning, construction, and maintenance, all 3 of them working together. But when we work on the capital improvement, it goes beyond that. We obviously, Dr. Spiro, who is very integral to our process, Dr. Atkins is, finance, Trey, this is a multi-departmental project. And we evaluate these are kind of the want-to-haves. So a maintenance project that is truly a maintenance project would not come through this. And in fact, we ciphered it out. I'm going to go back a little bit to the beginning. There's an introduction paragraph. And I need the cheat sheet.
What would be the difference, and I'm looking at shelves.
So right here, you could see that we had 360 projects submitted to us this year as part of this effort. Of those 360 projects, 20 of those projects were to be school or grant funded. So they were a self-funded project coming from the school. They were asking us permission to move forward. And the reason that they come to us to ask permission to move forward is we want to make sure that they meet fire code, that they meet electric code, they meet facility codes. We also want to make sure that it's something that we as a district don't want to set precedents on, or other things, so they're meeting district issues. So, but these were 20 projects that we were not going to contribute to. They are being self-funded somehow through the school. Then there were 81 projects that met the $250,000 or less threshold. So there were 81 small project considerations. The next were 56 large project considerations. Those are the 250 or greater projects. And then there were 203 maintenance projects, and they could have been rotational projects, they could have been safety and security projects, they could have been IT projects, they could have been food and nutrition projects. They were just projects that were going to get funded somewhere in the district some other way in our regular work that we do. Those 81 projects that were the small projects, as again, those were the kind of want-haves. Those were it would be nice to put a door here, but it's not a requirement. It would be nice to add a playground here, but I already have my SREF standard 2 playgrounds that I need. It would be nice to add some technology into this classroom, but it's above beyond what we would normally be doing. So that's what that money is for. It's a way for us to evaluate those want-to-haves and prioritize them, recognizing that we can't do every want-to-have that we have in the district. As you can see, we had 81 total projects and we picked 7.
Okay, I just wasn't sure the logistics of how the schools did that, but they go through you.
They go through
your
us.
department.
They go through our process. I wouldn't say it's our department. They go through our team.
Okay.
And we did that because we want every project to have an equal consideration. What was happening in the past, and what Dr. Atkins asked us to address, is he wanted to make sure that every project got to be evaluated against each other. Think of them as competing projects. You have to compete against somebody else. You can't just say, come in and get, yeah, I'm going to give you, and then the next one, which actually might be a better idea, but we don't have any money for it, they can't get done.
Yeah, no, I give it a thumbs up, because it's not like first principal through the gate begging you gets the prize. I like that. That's
Gets
good.
evaluated at the same time, in the same process, against your goals and values and priorities that you establish. So it's not us making those decisions. We're looking at them against what you asked for, and do these projects meet that question mark?
And I think that's a whole lot more fair. Yeah.
Ms. Gittens?
Just 2 quick questions. One, when I first started on the board, we had discussions about using existing facilities, especially for something like the, I can't think of the word of it now, the technical centers. We had that discussion. And with a previous person in your position, we talked about, for example, on Milwaukee and Homestead and Lehigh, that strip mall that's there that has
Adaptive
been sitting
reuse.
there since it was created.
Yep.
And every time I go by there, I can see, an automotive thing in the back, and a restaurant, and a place to get your hair done and your nails done, and all of those types of things. Are we looking at that at all?
Yes.
That type of a situation?
So when we evaluate projects, what you're talking about, I'm going to throw a technical term at you, adaptive reuse. That's what we call them. Adaptive reuse projects.
Okay.
Yes, we do look at those. We have schools right now. Raymond Page is an adaptive reuse. It used to be an old Kmart, I believe. Right. So we do adaptive reuse projects, and in the right place. I mean, this building is an adaptive reuse project. We're sitting in one. So yes, wherever we can utilize resources that are already provided for us in the community, and it makes financial sense for us and it works for our needs, we definitely look to do that. It doesn't always work for us. Sometimes it's more expensive.
Right, and I've
Often,
heard that.
because remember, you're building a developed piece of land. Greenfields are usually cheaper. It's a total equation. It has to be in the right location. If we were to buy, there's a number of projects that are available for sale on 41 right now. That's not where we need a new technical college. So it has to be in the right location. It has to make sense for us. It has to be able to be used in the way we want it to be used for the purpose we're looking for. But it's definitely something we evaluate as we're evaluating different projects.
And especially the location of that close to the high school, a couple of, middle schools and all of that. And the project you were talking about before of having that connection between middle schools and high schools and getting kids ready. And also helping the community that if you can offer a service at a reduced price because it is a training school, something of that nature. So please keep us updated on that. The last thing I have to ask is about the property on Tuckahoe. Is it off of Joel? Where are we with that at this point?
Dominic?
Ms. Giddens, what would you like to know about it?
Are we at, there were a couple of things, and I had gotten information or question from someone in the community about using a part of it for their cows and stuff like that. And is it just sitting there? Are we going to sell it? Are we going to use it? What is the situation?
It is one of our properties it is partially marketed now. I have spoke to that particular farmer that I believe you must have been in contact with. He's actually is interested in leasing the entire piece of property and putting cows on it, which is an option that we don't have an immediate use. He doesn't have a long-term use that he's looking for, so that's something that I'm bringing to our capital committee in our next meeting.
Okay. Thank you. I didn't know what had happened with him. Thank you.
Ms. Patrica?
Just before I assume you're finishing up?
Yes, I am.
So I don't know what I'm more impressed by, the first presentation or the last one of the day. Unfortunately, you get me where I've been sitting here for I don't know how many hours, so I'm a little less energetic than I was in the beginning, but this is phenomenal. This is, there can be no question about what we're building, why we're building it, what we're maintaining first, what we're maintaining second, what we're giving our attention to third. You have listened to the board, you've listened to the leadership team, and you've brought us a plan that, in my estimation, is beyond reproach. And I've got a couple favorites in here that and they're not all necessarily located in the South Zone. This Veterans Park Performing Arts Center, it just makes me so happy for that community and for those kids and that school. And that's the only one I'm mentioning because it happens to be right in front of me. But you deserve a lot of credit. Kathy, I think you bring a high degree of professionalism to your seat and an understanding of the community, like the fact that you haven't been here that long and you know off the top of your head that Rama is a converted Kmart. I don't think I knew that until like my third year on the board. So the fact that you know your area so well gives me even more confidence in what you've presented here today. So just thank you. And thank you for giving me something non-COVID related as well. I really appreciate that.
Are there any other questions?
Did she finish?
No, I'm just making sure.
Thank you very much for your time today. Again, Debbie, you helped us find one typo. I do think it's more, I don't think it's two. I can't remember, but we'll confirm that and look at exactly what that dollar figure was. But if there are typos, we have looked at this document probably to the point that we have memorized this document. I really wish Cindy was here, our new senior planner, because she deserves most of the credit. She put most of this together. But if there are things that you would like to see change, please get them to us. If we could get them by next week, then we can make sure this gets adopted on the consent agenda in September. And we look forward to your comments. We look forward to fixing anything, and we look forward to bringing this back to you next year. The next time you'll see the CIP is in October or November, when we'll start next year's process all over again.
Thank you so much. I really appreciate you.
I do have.
Does anybody, I'm sorry.
I just want to say thank you too, because I've been asking for this for a while, so I am very excited because it's something that the community really wanted to see, and this is so beneficial to see the plan and see it, in black and white and ruled out, and then I can't wait to see the fruits of all your labor, because it's going to be awesome. So thank you.
Well, one thing you will see next year is all the pictures will be updated. So we'll be showing you a progress of the pictures from year to year. So you can, I promise you, they won't be the same next year.
Well, I will tell you, even the Fort Myers Middle, that does not do it justice of what it looks like today. So I really appreciate it.
Thank you, everyone.
Thank you. Does anybody need to take a break, or are we good to go? Okay. Okay. Oh, I'm sorry, Dr. Atkins, did you have anything to say? No? Okay.
No.
So moving right along, we are to the public comment portion of the briefing. Do we have any?
There's one, Madam Chair.
Yes, yes.
There's one, Madam Chair.
Thank you.
School board policy provides the opportunity at this point in the meeting for members of the public to address the board concerning any matter on this briefing meeting's agenda. The subject of comment is limited to those items on the agenda, and the time permitted is 3 minutes per speaker. We encourage each speaker to wear a mask during the public comment. And speakers who are asked to be respectful, and the purpose of public comment is to provide feedback on this particular briefing's agenda. Personal attacks on individuals or abusive language are prohibited. In addition to clapping, hissing, and booing are prohibited. Speakers who fail to follow proper decorum in the chambers will be ruled out of order. I believe there's one public comment, Madam Chair.
Okay, thank you. Please state your name and proceed.
My name is Randy Scott. The agenda seemed to have been limited, but it seems like the discussion associated with the agenda just went way out. It went everywhere. It touched on every possible subject in this district. First of all, I'd like to congratulate Dr. Atkins on his successful onboarding and master board training. The board appears to be one, united with the administration. In regards to the capital expansion, the brick and mortar, when I was on the Finance Advisory Committee, I gave a warning. I said that we are moving in a new direction, that we are moving to virtual. And lo and behold, beyond my call, beyond my notice, we got 35% of our students virtual. I think the building expansion is a waste of time. I think in 20 years, what you have now before you, that you're trying to protect like a risk game, spending money to build, won't be needed. The interlocal agreements that you talked about, we have a constitutional requirement to provide education in Florida. We don't have a constitutional requirement to tax the members of our community to provide public education, and then for you to funnel that through other political subdivisions by making beneficial deals with them. That's the education money, not Fort Myers Beach, not the sheriff's department, not these other people who want a little bit of take. In regards to the COVID and the spacing issue, how much more foolishness can we look at? You're going to say that someone who's sitting 4 feet apart from each other is going to have to be notified as a potential infected person? Well, from what I understand, it was supposed to be where you are today for 72 hours, that droplet will live. So in time and continuum, 6 feet ain't going to do it. It's going to be the aisles they're walking down for 3 days. This is foolishness. It's absolutely foolishness. None of it makes sense. It really doesn't. You know, I understand that public education requires to meet certain other needs of the students. We're talking about giving them food. But where does that end? Are we going to be buying the parents' cars because they can't get to work? Are we going to get them clothes so they look better and presentable and everyone's equal? You guys are spending recklessly. You're united as one. You're not individual thoughts. Thank you.
Thank you, Mr. Scott, and thank you for sharing your comments with us today. Moving right along, please. We now go to board member comments. If I may start with Ms. Giovanelli, if you have any comments.
I have none.
Thank you. Ms. Patrica?
I'm going to do my board report now because I'll be more tired tonight than I am right now. A few things I'd like to go over. I had my first EDAC meeting, Executive District Advisory Council. That went great. I'm looking forward to working with you, Dr. Spiro, this upcoming year. I started at DAC. That was how I started to get involved in the district beyond Pine Woods, and I love that group, so I'm excited there. I did give a presentation on reopening to the Lee County Bar Association. I thought that went really well. Some good questions. Only one I was unable to answer, and I believe Dr. Atkins' office provided that answer to Matt Repsdorf for his membership. FSBA Advocacy Committee, if I may, Madam Chair, what is our deadline to get our legislative priorities? You don't have to, if you don't know off the top of your head, for us to get our legislative priorities to that group for their consideration?
I would definitely have to get that.
All right,
I will get that.
if you can look at that, and we as a board can consider scheduling a workshop for our legislative priorities in advance of that, so that we can make sure that, what I'm envisioning this year for legislative is more flexibility in existing statutes as opposed to, big new ideas or huge funding projects. Of course, we'll always be asking for more funding for teacher and staff salaries, but I think we are going to need a ton of feedback from Dr. Atkins and your staff, because you're seeing the impact that all of this is having, and testing, and whether we're going to be held accountable for that, and whatever else it is you feel that we need for flexibility. So I want us to be thinking about that. Rita Davis did what would you call it?
It was a,
Relaxation and meditation.
Meditation.
Yes, so she did a relaxation and meditation session for the Florida School Boards Association, and I think it was hugely successful. I think the people who were there loved it. The executive director of FSBA said, school board members across the state are under a lot of stress, and I think that's funny as I sit here and look at staff, because what you guys are going through is nothing compared to us. But she said, I was thinking of some kind of chair yoga or something to relax, and I was like, I have just the girl for you, because I think Rita is very dynamic, and she does have this sort of side niche thing that she does. And I was just really grateful that she gave us the time, and I was really grateful, Dr. Atkins, that you sort of loaned her to the association for an hour. So thank you for that. The feedback that I have been getting regarding Dr. Atkins and staff in the community and with partners, from Lee Health and from business leaders and from political leaders, has just been phenomenal. Dr. Atkins, you mentioned it earlier, you think we're in good shape as you look at other districts, and that is definitely the sense that I'm getting. And it's not just other districts, it's other states as well. The fact that we are able to provide parents and teachers with the choices that we're able to provide to them has really, really been fantastic. So I know you're not going to take credit for it, and this genuinely is a huge team effort. I know you're working hard, guys. Keep at it. It's being recognized. The community sees what you're doing. You are getting the frustration of parents who want answers right away. That's the mama bear that comes out that wants to protect her kid. But ultimately, the bottom line is the vast majority of the feedback I'm getting is, yes, I know I'm frustrated. I want to know now, but you guys are doing a good job. Keep it up. So please know that you're appreciated. I do have a communication question, Dr. Atkins, and you don't have to answer this for me right now if it's something you could consider. Ms. Gittens was speaking earlier about simplifying, and I'm actually going to ask a question on the other end about being more technologically advanced. So sometimes I get notifications on my phone from my children's school, and I have to open 3 different links inside, and then when I open it, it's a PDF, and in order for me to get the appointment onto my calendar, I then have to open my calendar and put it on my calendar via hand manually. There's got to be a way in 2020 that schools can be sending me a notification that I just press the button and it automatically goes to my calendar. Does that make sense? Mm-hmm. That's one thing. And the other thing too is, now that I've got 4 kids in 3 different schools, I'm seeing very different means of communication and different quality of communication from different schools. So if I look at one school's Facebook page or one school's Twitter feed, I might get a ton of information, and then a Twitter feed or Facebook page might not even exist for the other school. So is there a way that we could sort of go through, I know we're really busy, but communication is so important right now. Is there a way that we can go through these various social media platforms for each school, determine what's working? Where do we have a lot of communication and interaction with that school community, and perhaps push out best practices to schools for them to know how to do this, kind of similar to what Ms. Gittens was mentioning with the Facebook Live for the board? Maybe we could do that for all schools. Just a suggestion, just something I'm thinking about as I'm getting feedback from the community. And the last thing I wanted was, are you, during your update, going to talk to us about, Attorney Dupree-Bruno, I mean to point at you and say you, talk to us about the FEA lawsuit?
I can do that during, oops.
Yes.
Okay, so the specific question I have there is, I was really surprised that he came out the way he did on the law. So I understand the facts, and I understand that they, pulled at everybody's heartstrings, but it's my understanding that the burden of proof was beyond a reasonable doubt, and I don't know how he got to beyond a reasonable doubt based on the facts that were presented in that case. So if in your comments you could address that, that would be great. Those are my comments. Thank you.
Thank you. Ms. Fisher?
I have no comments right now.
Okay. Ms. Gittens, please.
In listening to, all the information and everything we've gotten this afternoon, and I have said as well, kudos to everyone that presented. The thing that just keeps coming to my mind is communication, communication in a manner that everyone from top to bottom can understand. And one thing that I want to bring up is where we are with the hiring of board secretary and that situation. And I would, is there someone that can address that at this moment? Because I do have a comment about it. Is anyone here?
I think Lauren can address that one. She's the one.
Might need that as a small project to attach that chair to the wall. The ad is out. We've been advertising, and I think we just checked today, and I want to say that there were 20 applicants. So we need to go through the applicants and everything like that, and then figure out what we're going to do from there.
Now, is that, can you explain, though, is that a, for the other secretary's position, the office manager position, where are we with all of that?
What do we do?
Additional position for the board office in order to support, there is a secretary that is out.
Okay. And where are we with what was presented to us at one point about an office manager?
Sorry, Lauren, could you please speak up? Everybody can't hear what you're saying.
Sure.
Thank you.
At this point, the last update was that we are not hiring for the office manager position due to budgetary reasons.
Okay, so thank you. My suggestion with that is that, of course, with the budget and all that is going on, and I would like us to discuss the fact of having Ms. Thomas just take over the position. She's been holding down the office singularly for several weeks, and she is doing, all in both positions. So the suggestion is, I don't know how, if she was just moved over as a secretary, but she is doing all of the duties of the office manager.
So she was put in, LaTanya, correct me, she's not in here, but no, she was moved over to permanently be the executive secretary in the board office.
Okay, so
Yes,
she
so
is
she's permanent to you.
replacing Susan.
Correct.
Okay. All right, and so we are not going forward with anything about a office manager between all of that?
Correct.
Okay. And the last thing with with our office, where are we on Attorney Dupree-Bruno's office build?
I will try to answer that question. I did make an inquiry just, was it last week, I believe, late last week. They've been in the process of securing the materials. So once we get the materials in-house, which should be in the very, very, very near future, they're going to start construction.
And which, maybe I missed it.
Good question. The option that we went with was the first option A, which was provided, I think, the largest space.
Where the existing, right across from where Mary was?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. Okay, and I think that's it.
Ms. Vaughn, please.
Yes, one thing that I was thinking about, and as a matter of fact, I had emailed, emailed back and forth a couple times with Ms. Stillwell on opening day of school this year. I know that traditionally quite a few of the board members will pop into several schools, and my thought was that unless somebody is specifically invited, there are so many challenges for the first day or two of school this year, and we have all the new protocols of the care that every school is taking in order to have people signing in. If it might not be a good idea to forego at least the first couple days of school board visits, unless you're specifically invited, just because, to me, both the teachers and the administrators are going to have so much on their plates that day, and things are going to be so different. I'm thinking in terms of, if I were a teacher or an administrator at a school, would I want to be entertaining a school board member? I personally am not planning on going. That's my choice, and I just wanted to bring it up and see what the rest of you thought or planned.
I don't get entertained when I go to a school. On opening day, I work. So I already have plans, and I will.
Oh, okay. I'm curious, because I don't know how that comes about. You work doing?
I escort students to classrooms.
Okay.
Kindergartners don't know where their classrooms are. They need help. They're crying. They need somebody to hold their hand and hug them.
Okay, so you've been asked to?
I've done it every year for the past,
okay.
I don't know how many years.
I'm just oblivious to it, so this is going to be an edification for me, for those of you that are more connected to classrooms because you've had children, your own children there, or a bunch of grandchildren, or whatever, yeah.
Does anybody else want to?
I mean, it's not a media opportunity for me. Nobody takes
No,
my
I'm not
picture.
saying that. I'm just
I work.
curious for.
I think, can I
Yes,
say, I mean, it's a personal choice, and I think that we all would be, aware of the fact of COVID and all of the things that we should and shouldn't do. And as far as I'm concerned, if you're invited, and it may be something that I may go and decorate my van and sit outside the school and toot and say hi to kids. I mean, there's things you can do, but I think that that's a personal choice in conjunction with the schools, and it depends on how comfortable you feel doing it. I don't think we need to make a ruling that we.
She's just trying to get some.
I'm just
she's
trying
just
to
having
get
a conversation
some,
about it.
Yeah, I just wanted to get feedback on how everybody felt, and
I just think that if people, like, sometimes, you're invited, if you're invited, to me, it's rude not to
well,
accept
no,
it.
that's what I said, unless
Right.
you're invited, that's.
Right. But we're not, like, I don't plan on going in, just popping in without an invitation. So thank you for bringing that up. Did you have some more to say?
No,
That was your comments?
Yeah.
I'm sorry, I'm sorry.
I have a standing appointment with a couple of my schools right in my area, and I plan to be there as usual.
Yeah.
Is that something you always do?
Yeah, I'm just, Kathleen, do you, because I'm wondering if it's just me, or if it's because I don't have a particular zone that I've ever been associated with.
Since I've been on the school board, I have never attended opening day for just the reason you said. I don't think people need me as a board member, a responsibility for me as a board member. So I do try to visit schools, but I have not gone on the first day to any school.
Okay, so it's an edification to me, since we are on Sunshine, just to see what other people do, and, maybe the fact that as an at-large school board member, that I don't have as close an association, or...
I don't think that's it, but I think Dr. Atkins wants to.
No, I was
Yeah.
just going to.
Oh, I'm sorry. Thank you.
All I want to say is I just want to be real conscientious, because I've had many calls from parents, from kindergarten parents that want to walk their children into class, and if you're there and they're unable to be there, I mean, I would rather give my spot, if that's the case, and give it to a parent. So, and you can't do that. So, and I think we have to respect what the schools have planned. They have a special orientation, I think Thursday. I know at several schools for them to have open house prior to the opening day. So I think it's important to, if, like you said, and if you're invited, that's one thing. But I think that under the circumstances with COVID is especially the issue. I think we have to be.
Yeah, and that's the only reason I brought it up for this year. It never really struck me one way or the other in other years.
Right.
But this is not like, this isn't normal.
No.
Not a normal opening, that's why.
So that's just my opinion, so I would respect the principal's wishes right now with limited germs.
Oh, that's
Well,
good.
just check with Dr. Spiro on that particular item. We are having the kindergarten open houses, throughout the week this week, so they have been occurring. And then on opening day, they have staff members that will be assigned to escort students from, the bus ramp or parent pickup to the classroom.
Well, will there be different, generally speaking, we're limiting people coming into the school, except for staff, of course. Will there be different protocols for school board members to come in this year, just to go into the schools? I know I've always made specific appointments, but apparently that's not how it's done across the board, which is fine. I'm not criticizing that. I'm just wondering if there's going to be different protocols for school board members this year, a little different from usual.
We had not planned any different protocols for school board members because honestly, the statute allows a school board member to visit any school.
Anytime.
So,
Right.
but the standard operating is just, you generally let the school know that you're going to be there, and usually heads up to our office. It's not required, but it's appreciated when it's done.
That's, and that really helps me, and it answers some of my questions on what's the norm and how everybody feels about it, and whether we are going to have different protocols. So I'll talk about the mass drive tonight. So that concludes what I'm going to say.
Okay, thank you. Ms. Morgan, please.
Well, I just want to echo what was said by another board member. This has been a fantastic afternoon in terms of presentations, both the notification and communication and the CIP. Wow, great information presented the way we need to hear it and in a way we can refer back to it. So I'm really, really, really excited by the briefing today. The only other comment I would make, I was going to do a good of the order on item G3 from the agenda tonight, and I don't want to take time tonight to bring it up as a good of the order, so I will just mention G3 is the item where we have a contract with someone to provide advice to the insurance task force and our insurance people about our plans. And I have talked over the years about the fact that I think we need to be engaging in a conversation with Lee Health. I have planned to support the recommendation this evening, but I'm hoping that I can persuade my colleagues to encourage the superintendent over the next year or two to look at our insurance plans and whether or not there are beneficial opportunities, both in terms of insurance relationships, but also in terms of clinics and things like that for our staff long-term. So those are my comments. Thank you.
Thank you. And,
But I'll wait till my comments.
Okay.
I was going to call you.
somebody raise their hand?
Oh, yeah.
Okay. And I have no comments, so and I know that I had asked Ms. Dupree Bruno, I will get it right one of these days, to speak on the lawsuit as well, so
Thank
you.
Thank you, Madam Vice Chair. Going to put this down just a little bit so I can breathe a little bit. With regards to the lawsuit, remember that it is a lawsuit that stemmed from a case that was filed by the FEA, the union, as well as the NAACP, challenging the executive order of July 6th, which was the emergency order to open up schools brick and mortar within 5 days. That case was originally filed in Miami-Dade, and then it was moved to Tallahassee in Leon County. Basically, a couple of things that the judge pointed out when reviewing everything was the March 9th order from Governor DeSantis declaring the emergency, as well as the March 23rd order from Commissioner Cochran, which basically said that COVID-19 poses a severe threat to the entire state of Florida, of course, as well as the July 6th emergency order. Now, when you're looking at it, the legal standard that was actually applied, because this was an injunction request, basically asking the court to please prevent the enforcement of the executive order based on constitutional issues. So the legal standard that was actually applied was, one, they had to show a substantial likelihood of success on the merits. 2, lack of an adequate remedy of law. 3, irreparable harm absent the entry of the injunction. Or 4, that the injunctive relief will serve the public interest. On all 4 grounds, all 4 of those elements, the court in Leon County found that the plaintiffs were successful and that parts of the executive order were unconstitutional. With regards to the one question that Ms. Patrica asked, well, let me go back a little bit. When the court was looking at the first standard, which is the standard on the substantial likelihood of success on the merits, the court looked back to see what happened in Hillsborough County a couple of weeks ago, where the board actually had medical professionals come in and testify that it was not the right time for schools to be reopened. And the court used that as an example as to why the executive order was unconstitutional, because the order does say that you are supposed to rely on what your public health officials are telling you, but because when the public health officials came in and said that it's not the right time for Hillsborough to open, the court found that the order was arbitrary and capricious. So that was one thing, and that's the first prong. With regards to the issue that Ms. Patrica discussed just now, the question that she had, it is true that part of the analysis does deal with a higher burden of beyond a reasonable doubt, but the court said that in this particular case, they met their burden, and what they used to justify was that Miami-Dade and Palm Beach County were under a different latitude for opening because they were still in phase 1, whereas Hillsborough was not. And the court said that in the executive order, there was no reference to phase 1 or phase 2. So that was something that the court found was part of the reason why they felt that it was unconstitutional. In addition, for the third prong of the analysis, which is the irreparable harm, it does speak to the 5% positivity rate, and again goes back to what happened with Hillsborough County when Hillsborough County went to the DOE and said we wanted to revise our plan, and then the DOE kicked it back. They basically said that, again, the public health officials gave you different type of advice, and it's not basically following what your executive order stated. And the court also said that with regards to public interest, that definitely allowing school boards to make safe determinations for reopening its schools without financial penalty is a very high public interest value. So what the court ended up doing is saying that some parts of the executive order were unconstitutional, but they could sever, in other words, take that part out, and the remaining parts of the order would still be in effect. The parts that they took out was, one, opening schools within 5 days a week for brick and mortar, the reopening plans that you had to submit that with the funding that went along with it. The court found that to be unconstitutional, and so in the conclusion, the court basically, those portions of that executive order were stricken from the executive order. So at this point, it's on appeal. This particular order from Leon County is stayed. We don't know if they're going to go back to the circuit court to try to lift the stay. We don't know at this point, and we don't know if it's going to go to a district court of appeals or if it will go directly to the Florida Supreme Court. The trier of fact in these types of cases have a large ability to try the facts, and the facts that they found will not be disturbed. It's going to be the conclusion of law that they reached. I hope that answers everything.
Ms. Patrica, you have a question?
So as I read the order and the parts of it that the parts of the executive order that were stricken, it appears that we still have the flexibility necessary to get full funding for our Lee Home Connect kids. Is that?
Yes, that's exactly what that says. Because the court was very specific that you can't hold funding if a district wants to move forward with virtual school.
And just for fun, I'd like to have a discussion with you later because I don't think you really addressed my beyond a reasonable doubt. I listened to all of the oral testimony. I was on vacation, but it was fun to listen to it. And I remember the defense attorney bringing up beyond a reasonable doubt, and I was shocked because that's typically a criminal standard. And if that is a standard for any one of those four prongs that you mentioned, I don't see how it was met. So just for fun, as going forward and looking at how the case might turn out, I'd like to have that discussion with you.
Okay, because there are different elements that the court does raise with regards to that discussion about beyond a reasonable doubt, making some distinctions between security and safety and high quality, et cetera. So that's a little bit more complicated in terms of our discussion, but I can certainly draft a memo and I will certainly discuss it with you offline.
Great, thank you.
Did anyone else have any questions regarding that? No? Thank you. Did you have anything else for any other comments?
No, ma'am.
Okay, thank you. Dr. Atkins, please.
Just one, just kind of a follow-up to what Ms. Bruno says. I just want to just reassure, our public, based on that, there's been some questions that have come in. Are we still on track to reopen on August 31st? And we are. I think we certainly have the support of our local Department of Health, I think, which is important. We also are looking at tracking local cases in terms of positivity rates, and they continue to be below 10%. And I think also we have a wonderful opportunity because we do have a number of our students that are in Lee Home Connect, so that gives us an opportunity to follow CDC guidelines at a much greater level than we would be able to do if we were all all hands on deck, every student reporting to school. So I just want to reassure the public that we are planning to, move forward, and that this particular action and the fact that it's on appeal, should not get somebody concerned that it would alter our reopening at this point. Okay? Some of the other things I wanted to mention, Ms. Morgan brought up, working with our local health providers. One of the things that you may or may not be aware of, that Lee Health has been working on really providing their own kind of a health insurance system. Innovatus, I think, is what it's called. It's actually been launched, and we have been in ongoing discussions with them as it relates to this product. Now, this is honestly, you're talking about literally going out there and offering this as, and there are options that they provide. Now, they are just now in the early stages at their organization, so we have an opportunity to kind of watch and see how this goes and continue to have those discussions. In the meantime, we're under contract with a third-party administrator, Aetna, and I think that is up in 2022, so we would have an opportunity as a governance team to go out and do an RFP and while watch this as well. So I think that we're going to probably see in our lifetime, the nature, we're already seeing the nature of health insurance and how it's provided change, and I think one thing Lee Health appears to be really on the leading edge of that. So there are some things that are differences in terms of how we do things such as wellness. You have to also think about out of the area, because they obviously provide within the area, but if somebody was on vacation, like Miss Patrica just was, that's not what I do on vacation, Miss Patrica, but,
It was fun.
Yeah, if you say so. But anyway, I think there are things like that we would certainly want to think about, but just know that we are continuing to work with them. So, just a couple other things that most of this came out today, so I won't go into a lot of it, but just again for public awareness and your awareness, Ms. Jordan brought a question to me about the spray bottles and all that. So I think you got an email. I did talk to Dr. Desamores after our discussion.
Oh, thank you.
And she said, yes, what happened was they made the order, then there weren't enough spray bottles that were included. They didn't know that at the time of the order, so then they had to order spray bottles. They are arriving, I believe, Thursday and being distributed out to schools, so we should be in good shape there. And then I think you'd mentioned paper towels, and she feels like we're on top of paper towels, but she'll double check, and if there is a concern there, she will have it addressed. So just wanted to give you an update as it relates to that email, I think, that you received. The other thing is that, I don't know if we actually said this to you, but I think it's important. We have decided to go ahead with a fogging protocol in all of our buildings so that every building gets fogged on a weekly basis. And we've got that scheduled in such a way that those buildings are going to be fogged in enough time where they'll be able to be cleaned prior to students coming back into those, and be able to be on the surface long enough to be active to do what they need to do. We are going to, first of all, ensure that everyone is fogged prior to our opening day, so that will be occurring, and then on a weekly basis into the near future. They have enough of this agent on tap to do this for 7 weeks at this time. I literally heard 2 semi-trucks were delivered, so that we would have enough on hand to be able to do this. So just wanted you to know that's an extra precaution that we've decided to take. And the last thing, I appreciate the comments today. Staff has worked extremely hard. They've done a great job. I think that we've really got a lot of expertise on this team, and what happened today, you all were a huge part of that. I think the CIP capital improvement process is just an example of how the input is important in terms of shaping, the plans that are moving forward. So, but I do appreciate the kind words and acknowledgement of that, because they have worked certainly extremely hard. So thank you, and that's all my comments.
I do have a question real quick, though. So so they're going to get the sprays will go, the nozzles will go to the schools, and then as far as the hand sanitizer, will we be looking at ones that they just pump versus having to actually physically put on children's hands? That was the other one that we had looked at. And then, and I don't know if I should have asked Ms. Ebal on this, the water, the handless water fountains, I heard that they're not all going to be installed before the 31st, is that?
My understanding, they will not all be installed by the 31st. I know that our executive directors are working with our school principals to be able to put in other protocols that will allow students to get water in a container in a safe manner. So, which we had planned to do prior to, but when we had this opportunity, we went ahead and pulled the trigger so that we could get the handless.
So do we know when that, when the rest of those will be, the rest of them will be there and put in? Because I know Fort Myers Middle was one of them that's going to open 2 water fountains for these kids, but we need to make sure that we get those installed. And it just slipped my mind till just now. Yeah.
I'm happy to put the best, most current information on an estimate for maintenance in this week's board update to get you that specific information. Just to add clarification for Dr. Atkins, as he stated, we had planned to use cups with certain fountains, and so the school development and folks are working with those schools to be able to use the fountains they can with those developments and sanitize after using those pieces without putting their mouths directly on it. So that was the intent, and that's kind of the gap filler until all of them are installed. All of the refrigerated ones are still planning on being installed. They simply, the supply to get them all done, just with the demand across the country, it's a challenge to do that.
Okay, because I thought we went with that company to make sure that because they had adequate supplies for all of our schools, and now they do not.
Yes, we'll be happy to provide more detail on that.
Thank you.
Specifically in the response.
I appreciate that.
No problem.
I think Ms. Vaughn had something.
Yeah, just, is the fogging then being done in-house?
Yes.
And is it the maintenance workers that are attached to the school, or will we have a team of?
You got that one?
It's yes, we have 5 specifically approved vendors that we currently use for that fogging. We procured the product. We use them for the service of actually doing it. So they're wearing the protective gear. This is not our maintenance staff that's doing it. It's product we procured, but the crews are 5 of our district approved vendors that go out and do this work.
Oh, okay, because that's what threw me off when you said we've gotten the fogging agent, but,
yeah,
okay,
maintenance was letting me know we got the fogging agent today, and
4 semis worth, I believe.
Oh, was it 4?
4 semis worth
of
the material to get us at minimum 7 weeks worth to get all the schools once a week, focused on the middle of the week. The intention there, if you want more detail on it, is just the nature of the latency in the testing creates an issue where by the time you have a positive test, there's a lag there. And so then, that's an issue. So by doing it preemptively on that weekly basis with the current level of community spread that we're experiencing, this will in effect have a positive impact on reducing the amount of positive foggings that we'd have to do by getting ahead of it.
yeah, I'm just curious if you could send all of us several price points, depending a small, medium, or large building. I'm not saying that we should be doing it, but just curious what the labor cost is on that.
Absolutely. Yeah, we have the negotiated rates per school for the elementary schools. Currently, it's $3,885. Middle schools, it's $4,775. The high schools, it's $5,880. And then when it's just a portion of the building, it's a percentage of that square footage relative to that building. But when they do the entire school, those are the flat rates negotiated to try to secure us the best price. The initial foggings that we did with vendors before we were able to get to that negotiated rate, some of them exceeded some of those amounts. They used the existing fogging of what it cost to get us down to that rate so that we wouldn't, it would be consistent across the district in this type of cycle of what we have.
Okay, thanks.
And we'll be happy to provide that to you.
Yeah, I wrote down part of it real quickly, but I just...
Thank you, and seriously, Ms. Stillwell, thank you so much. Those updates are tremendous for all of us. Does anybody have anything for good of the order? If not, this meeting is adjourned, and we will be back at 6 o'clock. Thank you.